गुरुर्देवो महेश्वरा गुरुर्साक्षात् परब्रह्मा तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः.
Very warm good evening to one and all. On behalf of Sameeksha, I invite you all for the today's session. We know that Sameeksha is an organization started by many of doctors and house surgeons with the aim of developing the knowledge of Ayurveda in a way that is accessible to all physicians for the advancement of Ayurveda around the world. From the very first step of Sameeksha on the subject of nervous system, we were made aware of the importance of nervous system in Ayurvedic treatment. The associated gynecology, obstetrics and Ashwabagandhidiyam classes received a lot of attention. Similarly, our international seminar also received a lot of attention. The single session we conducted was very focused on the upliftment of BAMS students, clarifying job opportunities outside India, information on what to do for the MOH exams and completely dispelling the doubts of many related to it. In addition to these seminars, several cases including photos were presented to make it easier for our growing young doctors to understand the treatment of diseases in each condition. Details of our seminars are displayed on the screen. Those who wish to watch these seminars can send a message at any time to the WhatsApp number displayed on the screen for the recordings of seminars. Let us go to today's class to learn more about becoming a good doctor by praying to Jagadishwar that he will bless all our Ayurvedic doctors to excel in the field of treatment.
Hello everyone. Good evening and a warm welcome to one and all. First of all, thank you all for showing your interest on the seminar presentation. I welcome all to Avabhasini national level paper and poster presentation presented by Team Sameeksha. And may I take this opportunity to welcome our respected panel members. First of all, I would like to invite Agada panel, Dr. Ashwadi S, Dr. Veena and Dr. Revati Raj. Next, I invite our Swasthavruta panel, Dr. Sujitra, Dr. Rashmi R and Dr. Sridevi. Next, I invite Prasuditandra panel, Dr. Deepthi, Dr. Sri Lakshmi and Dr. Krishna Priya. Next, let me invite Kaumara Pritya panel, Dr. Arati Dinashekar, Dr. Sulata Nandakumar and Dr. Rajneesh. Next, I would like to invite our Kaya Chikitsa panel, Dr. Ramesh, Dr. Bhagya Soman and Dr. Kavita Raj. Next, I would like to invite Shala Kitandra panel, Dr. Bilender Bophale, Dr. Vaishab Raj and Dr. Arya K. Panikar. Next, I invite Dravya Guna panel, Dr. Vishwanath Patil, Dr. Sridega and Dr. Kalyani. Next, I invite Shalitantra panel, Dr. Arun Krishnan, Dr. Krishnanandasiya and Dr. Usha. Now I invite our Panchakarma panel, Dr. Jinsi Joseph, Dr. Mahesh and Dr. Ashwini Somasundaram. Now I invite our Samhita panel, Dr. Rama Devi S and Dr. Kavita Sajish. And I invite our Rasam Vaishudhya panel, Dr. Ramyaji and Dr. Sindhu Lakshmi. And finally, I would like to invite our Rajana Sharira panel, Dr. Vivek, Dr. Sri Lakshmi, and Dr. Krishna Priya. And before get start, let me remind you something. Dear participants, please be there on time and follow the time limit while presenting. And without any delay, we can start the first presentation. So first, I would like to invite Dr. Anushree CG for the paper presentation.
Yes, ma'am. Am I audible?
Yes, doctor.
Is my PPT visible, ma'am?
Yes, doctor. Please start.
Yes, good evening, everyone. Myself, Dr. Anushree CG, final year PG scholar from SDM Hassan, Karnataka. Today, my topic is Dashanga Agada in the management of Keeta Visha. Introduction. Dashanga Agada is one of the most widely used formulation of Ayurveda Shastra. Its first reference was taken from Kashyapa Samhita, Visha Adhikara. Another reference is from Ashtanga Hridaya, Uttaratantra, 37th chapter, and it is used in the form of vati. As the name suggests, it has 10 ingredients, out of which 9 are herbal and 1 is mineral. And references are Ashtanga Hridaya Uttaratantra, Ashtanga Sangraha Uttaratantra, Chakradatta Chikitsa, Yoga Ratnakara, Visharoga Adhikara, and from Bhaishajya Ratnavali. Shloka goes like this: Vacha Hingu Vidangani, Saindavam Gaja Pippali, Patha Prativisha Vyosham, Kashyapena Vinirmitam, Dashanga Magadam Pitva, Sarvaketam Vishanjayat. It is taken from Ashtanga Hridaya Uttaratantra. Ingredients are Vacha, Hingu, Vidanga, Saindava Lavana, Gajapippali, Patha, Prativisha, and Trikatu. First is Vacha. Botanical name is Acorus calamus aracaceae. Chemical constituent is saponin, volatile oil, lectins, and part used is Mula. And its rasa is Kashaya Tikta, Lagu Tikshna Guna, Ushnavirya Katuvipaka, Vata Kafahara, and Pitta Kara. Karma is Vedana Stapana, Jvaragna, Krimigna, and Rogagnata is Shita Pitta Prashamana, Sanya Stapana, and pharmacological action is neuroprotective, anti-convulsant, antispasmodic. Hingu, botanical name is Ferula natrex, umbelliferae. Chemical constituent is ferulic acid. Part used is Niriasa, stem, leaves, and flowers. Its rasa is Tikta Kashaya Madhura, Lagu Snigdha Tikshna Guna, Ushnavirya Katuvipaka, Vata Kafahara Pittakara, Karma is Sanya Stapana, Veda Stapana, Rogagnata is Kushta, Pandu, Shvasahara Deepaniya. Pharmacological action is anti-cancerous and anti-convulsant. Vidanga, Embilla ribes, Myrceniaceae. Chemical constituent is embillin, cristambin, and part used is Phala and Mula. Kashaya Tikta Rasa, Lagu Ruksha Tikshna, Ushnavirya Katuvipaka, Doshagnata is Kafavatahara, Karma is Krimigna and Kushtagna, Rogagnata is Krimi Jvara Kushta, pharmacological action is anti-helminthic. Gajapippali is Syndaspis officinalis, Aracaceae. Chemical constituent is Syndaspin A and B, and fructose. Part used is fruit. Its rasa is Katu Madhura, Lagu Snigdha Guna, Ushnavirya Katu Vipaka, Kafavatahara, and Deepana Agnivardaka. Rogagnata is in Atisara, Shvasa, Kasa, Krimi. Pharmacological action is anti-cancerous, antioxidant. Patha, Sesapulus pereira, Menispermaceae, hyatidine is chemical constituent. Part used is Mula Patra. Madhura Rasa, Lagu Tikshna Guna, Ushnavirya Katu Vipaka, Doshagnata is Vata Kafahara, Karma is Sandhaniya, Rogagnata is Jvarahara, Stanya Shodhana. Pharmacological action is anti-cancerous, anti-diabetic and nephroprotective. Prativisha is Aconitum heterophyllum, Ranunculaceae. Chemical constituent is atidine, aconitin acid, tannic acid, etc. Part used is tuberous root. Its rasa is Katu Tikta rasa, Lagu Ruksha Guna, Ushnavirya Katu Vipaka, Kafapitta Hara, Deepaniya Pachana Grahi, Rogagnata is Amavata, Aruchi, Atisara, Kasa. Pharmacological action is anti-cancerous, anti-arthritic, antibacterial. Shunti gingiber officinalis gingiberaceae. Chemical constituent is A. curcumine, gingerol, gingeron, and part used is Kanda. It is Katurasa, Guru, Rukshaguna, Ushnavirya, Katuvipaka, Kafahara, and Karma is Deepana, Triptigna, Arshogna. Rogagnata is Chula and Trishna. Pharmacological action is hemostasis, antithrombotic activity. Maricha, Piper nigrum, Piperaceae. Chemical constituents are alkaloids, piperin, deptinin, and part used is Phala. It is Katurasa, Lagu Tikshna Guna, Ushnavirya Katuvipaka, Vata Kafahara, Shotagna, Krimigna Karma, Rogagnata is in Kushta, Shota, Krimi. Pharmacological action is antibacterial, anti-cancerous, and anti-inflammatory. Pippali, Piper longum, Piperaceae. Chemical constituent is Piper longumin, and part used is fruit. And its rasa is Katu, Lagu Guna, Ushnavirya, Madhura Vipaka. Karma is Rasayana, Deepana, Doshagnata is Vata Kafahara. Rogagnata is Jvara, Kushta, Shula, and Udara. Pharmacological action, appetizer, vermifuge, anti-cancerous activity. And method of preparation, all the drugs mentioned above taken in equal quantity, powdered all the drugs separately, sieve through cloth and then mixed together in specified proportion, followed by bhavana with jala and prepare gutika after getting desired consistency. And then it is dried under shade, pack in a tightly closed glass container for further use. Indication in Sarva Keeta Visha and in Amavata in the form of lepa because it is having anti-inflammatory analgesic property. In Shota as Vidanga Prativisha, Maricha and Pata have Shota Hara property. In Shula as Vacha, Hingu, Pipali have Vedana Stapana properties. Dosage. In classics, the dose of Dashanga Agada has not been mentioned, but in Vaishajya Ratnavali, it is mentioned that 3 grams of powder form. Size of gutika, it is a standard dosage of vati preparation is 1 karsha. In practice, Dashanga gutika is prepared as 1 gram pills. And articles are a review on Dashanga Gutika, of physiochemical analysis of Dashanga Agada and Ayurvedic formulation, and evaluation of Dashanga Agada in the management of sting envenomation. And probable mode of action, Vacha, Hingu, and Pipali are having Vedana Stapana action, which will act on the Keeta Damsha. Vidanga, Prativisha, Maricha, and Pata are having Shotahara action. Prativisha and Pata are having Vishagna action. Most of the drugs are having Ushnavirya, which may act quickly in emergency condition like Visha, as pain, swelling, and redness are the primary symptoms of Keeta Damsha. So by the virtue of above properties, Dashanga Agada is indicated in Keeta Visha. Thank you.
Thank you, doctor. So next I invite Dr. Khan.
Hello, am I audible, ma'am?
Yes, doctor. Please start.
Good evening, all the panel members and all the co-presenters. Bhagwan Dhanvantri, Adi Deva. My name is Dr. Tarannum Khan. Khan. I'm from Kai Chikitsa Department, final year student of DMM Ayurved Medical College. And my title of the study is Role of Guduchyadi Churna in Treatment of Pandu Roga. It is a case study. Introduction. Pandu Roga is often described as a symptom and complication in many disorders in Ayurveda. But simultaneously, our acharyas have mentioned it as a disease, and its treatment has been mentioned in detail in Ayurveda text. The history of the disease dates back to times of Vedas and Upanishad. It is mentioned in Rig Veda that they use sun rays as a treatment in Pandu Roga. It is also known in history that the father of Pancha Pandavas suffered from Pandu Roga. Thus, it becomes significant for us to study and treat the disease as a separate identity. Pandu Roga has been correlated with anemia in modern science. The epidemiology. Globally, anemia affects 1.62 billion people, which almost corresponds to 24.8% of the population. Highest prevalence is in preschool children like 47.4%, and lowest prevalence is in men, 12.7%. According to WHO region-wise record in Southeast Asia, including India, the prevalence rate is 14.9%. Prevalence rate in women, non-pregnant women, is 29.6% and 36.5% in pregnant women globally. In India, about half the percentage, that is 51% of women, are anemic. This is a case report, and the patient name is not revealed. She was 65 years old from Tivisa, Yavatmal, Maharashtra. The chief complaint she came for was Panduta since 2 years, Darbalya since 2 years, Pindikodeshtan since 2 years, Aruchi since 1 year, Brahma since 1 year, Shrama since 1 year. History of present illness. A patient named X of age 65 years old, resident of Tivisa, Yavatmal, visited Kai Chikitsa OPD of LK Ayurvedic Hospital, Yavatmal on 5th April 2022 with the above said complaints. The patient has not undergone any treatment for the above said complaints with any doctor before. History of past illness. There was no history of hypertension, diabetes mellitus, hypothyroidism, cardiovascular disease, or any other medical conditions. There was no surgical history found. Personal history, diet was mixed, and there was Viruddha Ahara Sevana. Appetite was reduced. Bowel habits were 1 to 2 times a day, regular and normal in consistency. Micturition was 4 times a day, 2 times a night. Color was normal. Sleep was in Prabhut. Addiction was tobacco since 10 years. On examination, all the vitals were normal. Ashtavid Pariksha. Nadi was found to be Pitta Kafaj. Mala was Sama. Mutra was Samyak. Jiva was Sama. Shabda was Spashta. Sparsha was Anushna Shita. Drika was Pala was present. Akruti Krishna. On investigation, we did CBC, and according to the symptoms and investigation, we diagnosed the patient with Pandu Roga. Then we gave therapeutic intervention, which was Shaman Chikitsa, as follows. Guduchyadi Churna in 3 gram dose twice a day after meals was given for 45 days with lukewarm water as Anupana. The reference of Guduchyadi Churna is found in Bhesajya Ratnavali, Adhyay 41, Pliha Yakrit Roga Chikitsa Prakaran. The shlok goes as Guduchi Ativisha Shunti, Bhu Nimaya Tiktakam, Mustakana Yavaksharam, Kasisam Brahmanatiti, Edisham Sambhagena Chuna Be Vinikshipet, Yakrit Pliha Pandu Rogam, Agni Mandam Arochakam. As we can see, there is mention of Pandu Roga in the shlok itself. These are the contents of Guduchyadi Churna with the rasa and gurna. Mainly, it has tikta and katu rasa, and vira is mainly ushna virya. We'll see the probable mode of action later. The results are shown in the table below. Before treatment and after treatment, the HB percentage before treatment was 8.6 gram%. After treatment, it was 10.1 gram%. Total RBC count was 4.73 million per cubic mm. After treatment, it was 5.17 million per cubic mm. TLC 7830 per cubic mm before treatment, 6340 per cubic mm after treatment. In DLC, neutrophils was 56% before treatment, 50% after treatment. Lymphocyte was 36% before treatment, 42% after treatment. Eosinophils remained the same, basophils remained the same, monocytes remained the same. If you look at MCV, the value was 67.7 FR before treatment, 67.5 FR after treatment. MCH was slightly increased, 18.2 pg. And after treatment, it was 19.5 pg. Same goes for MCHC. It was 26.8 gram per DL before treatment, 28.9 gram per DL after treatment. Discussion. Pandu Roga is a rasa pradosha vyadhi according to Acharya Charaka and also according to Acharya Vagbhata. The pathogenesis indicates that there is improper formation of ahar rasa, which in turn results into improper formation of rasa dhatu, as each dhatu is a precursor of the next formed dhatu. Thus, it is important that thus it causes improper means both reduced and low quality formation of rakta dhatu, thus causing Pandu Roga. In this present study, the patient was given the intervention Guduchyadi Churna for 45 days, followed with a diet chart of Pandu Roga. Follow-up was taken on 45th day, and at the end of the intervention, all the symptoms were notably reduced at the end of the treatment. Before treatment and after treatment, CBC was done, and as the above values denotes that there is significant result in hemoglobin level apart from other red cell indices. Probable mode of action of drug. As Guduchyadi Churna contains Katu, Tikta Rasa and Ushna Vira Dravya, the action would be on Amapachan and proper formation of Rasa Dhatu from Ahar Rasa. This will ultimately lead to proper formation of Uttarotter Dhatu. Some of the drugs work directly on liver and spleen, like Guduchi, Yavatikta, Musta, Bhunim, thereby improving digestion and helping in proper absorption of iron in gut. Liver and spleen in Ayurveda, we can say that definitely are also known as the Raktavasrotas. So it can also work on the Raktavasrotas, forming good amount of Rakta. The drug also contains Kasi's Bhasma, which contains iron, which will further ensure that we are administering some amount of iron in daily dosage. There were some limitations also with the study, like the duration of the administration of drug was less. It was only 45 days. If it could be administered for longer time, it would have given more results. Since this is a case report, only one patient was studied with the positive outcome. So more population can be studied to judge the efficacy of Guduchyadi Churna on Pandu Roga. This concludes the case study. Thank you.
Thank you, doctor.
Thank you, doctor. Next, I would like to invite Dr. Devyani for the paper presentation.
Yes,
Dr. Devyani, are you there?
Yes, sir. Yes, sir. Am I audible,
Okay.
sir?
Audible, Doctor. Audible.
The screen is visible, sir.
Yes, Doctor, visible.
Thank you. Avabhasini National Seminar papers and poster presentation of August 2nd, 3rd, and 4th, organized by Sameeksha organization. I'm going to present on Agnikarma and its new innovations. Om Namani Dhanvantari. Myself, Dr.Devyani Dasar, Associate Professor from Department of Chalyatantra of Mahatma Gandhi Ayurvedic College, Hospital and Research Center, Constituent Unit of Datta Institute of Medical Sciences, deemed to be University of Vaidya. Efficacy of Agnikarma in Shleepad with special reference to Elephantiasis a case. Case study prospects are introduction, aims, objective, methodology, follow-up with the observation followed by discussion and conclusion. So this introduction, that elephantiasis is a rare long-term damage to the limb system, causes the swelling in the legs, and symptoms are edema, hypertrophy, and fibrosis of skin and subcutaneous tissue. While Acharya Sushruta told about that, Kupishta dosha vatapitta kapha adha prapanna vankshana uru jangha pradushyachena shofam janayana. So according to the modern sciences, treatment are antiparasitic drugs, antihistamines, analgesics, antibiotics, gentle wash to the skin, disinfecting wounds to prevent the secondary infections, while Acharya Sushruta gave the Chikitsa Upakram like Snehana, Swedana, Sira Vedana, and Daha Agni. Charaka also described about the Agnikarma in Charaka Sutrasthana and also Sushruta Chikitsa in Chikitsa Sthana. So aim is assessment of this efficacy of Agnikarma and Shleepad with special reference to elephantiasis, by having the objective to study the efficacy of Agnikarma and Shleepad with special reference to elephantiasis. So case report for this one is the female patient of age 46 years having complaint about the heaviness in leg, itching in lower leg with eruptions followed with the difficulty in walking since 15 to 20 years. And there is no any other diabetes mellitus or any other systemic diseases. Also, there is no any long use of any other drug. So we can see this one on examination. What I found that actually really this patient is very special to me, and this patient having all these complaints of 15 to 20 years, and she had a very difficulty in walking because that totally weight of that leg was too much unbearable for her. So heaviness in leg, itching in lower side of the eruptions. Here you can see all these skin eruptions with some secondary infections also and difficulty in walking. So methodology, whatever that as suggested by the Acharya Sushruta, Snehana Svedana, that I followed with the Dashmuntela and followed with the Agnikarma. So Agnikarma done weekly twice for 6 weeks with the Vidanga and Dashmula, each of 15 ml doses twice a day with lukewarm water for 3 to 4 months and follow for the 2 weeks. Here I did Agnikarma with the Panchadhatu Loha Shalaka for in Bindupada nature. So observation and results, what I found this one is it's really found most efficacious in this trial. Here, this is the procedure of that Agnikarma. So here we can see the spots of Agnikarma here. So all these areas I just covered with this one with Agnikarma by the Panchadhatu Loha Chalaka. So Agnikarma decreases the pain and heaviness, balancing the local Vata and Kapha dosha without any untoward effects, anti-parasitic effect by the aristas, and removes the inflammation and muscle spasm and normalizes the tone of the skin. Conclusion, Agnikarma found effective in the Shleepada. It may inhibiting the debulking for the patients with the advanced lipolymphedema. Then it is also easy to organize an effective Ayurvedic parasurgical procedure to patients suffering from the inflammation, suffering from the Shleepada. So these are the references. Practice makes perfect, but research makes it refined. If this refination starts with you. And I'm really thankful to the team of Avabhasini for giving such a nice platform to me. And thank you so much for organization for a nice and good platform to all of us. Thank you so much.
Thank you, doctor. So next I invite Vaidya Rachana Jajal for the paper presentation. I invite Vaidya Rachana. Hello, Dr.
Okay.
Rachana, are you there?
Hello, Dr. Rachana. Okay, next I would like to invite Dr. Pooja for the paper presentation. Dr. Pooja Sanjeev, are you there?
Yes, sir. It's
Okay,
Mamta T.
Okay.
Is this Dr. Mamta or Dr. Pooja?
This is Mamta T. I have login ID by Pooja. Yes, ma'am. My
Okay,
name
doctor.
is not opening. So.
Okay, doctor, your screen is visible, doctor. Please start the session.
Is this visible, sir? Hello.
Yes, doctor.
Yes, namaste all. Myself, Dr. Mamta T, second year PG scholar from Department of Ayurveda Samhita Siddhanta, STM Ayurveda College of Hassan. Today my topic is conceptual study of Trisutra in Amavata. Hello. Hello.
Doctor, please continue. You are audible.
Ma'am, it's not moving, ma'am. Slides are not moving.
No, it's not moving. It's still in the first slide.
Yes, ma'am. One second. Is this visible, ma'am?
Yes, doctor.
Yes, doctor, visible. Can you change the slide, doctor?
Sir, I'm trying, but it's
Okay, doctor. It is moving, doctor. Now it's moving.
yes, sir. Okay, thank you, sir. My contents of the topic is introduction, aims and objective, concept of the Trisutra, concept of Amavata, Upashaya, Anupashaya, and conclusion. Introduction. The concept of Trisutra has been explained in the Charaka Sutra, first chapter, 24 shloka. The shloka goes like this: Hetulinga Aushadha Gnanam, Swastatura Parayanam, Trisutram Shashvatam Punyam, Ubudeyam Pitamaha. Ayurveda is for the fulfillment of aim of maintaining the health of a healthy person and to cure the diseases of a patient. This clarifies that the concept of Trisutra in Ayurveda is for both the Swastha and Atura, and its knowledge is well versed in the Ayurveda. Amavata, which is one of the most commonly occurring clinical conditions of Rasava Shroto Vikara, is first described as an independent disease in Madhavanidana. Here, efforts have been made to understand the diseases of Amavata. Aims and objective: to study the concept of Trisutra, to study the diseases of Amavata, its prevention and remedies with the help of Trisutra. Concept of Trisutra. Trisutra is Ayurveda. In Ayurveda, Hetulinga Aushadha with the help of healthy persons and can be cure the diseases of the disease and unhealthy person. Hetu means find out the cause of the diseases. Linga, that which can help in the diagnosis. Aushadha, which helps in the maintaining of the health of the treat, as well as the treatment of the diseases. In both of the Swastha and Atura, it has its importance as who are Ayurvedic based on. Hello. Hello.
Yes,
Hello,
doctor, you are audible, but your PPT is not visible.
Yes, ma'am, there is an internet problem, ma'am. I will check it out once, ma'am.
Okay, doctor.
Yes, ma'am. Is this okay, ma'am? It's moving?
No, doctor, it's not visible.
And is this?
Now screen is visible, doctor. Concept of Amavata slide is visible, doctor.
Okay. The concept of Amavata. The Amavata is a disease in which vitiation of the Vata and dosha and accumulation of ama takes place in the joints. Due to Durbalata of Agni, Annarasa becomes the Apakwa and it's called as Ama. This Ama along with the Rasadhatu and Vanavata gets lost in the Kafasthana, then it produces the Lakshanas like Sandishula, Sandishota, Vrishchikadamshavat, Vedana, etc. Utpatti of Amavata. Amam cha vatam cha amavatam. Madhavanidana tells in 25th chapter, second shloka, the main two factors for the production of amavata is ama and vata. Next, amena saha hato vata amavataha. Ama along with the vata is called as amavata. Definition goes like this: Yugapat kupito vanta trika sandhi praveshakau sabdam cha kuruto gatram amavata sa uchyate. That is the fifth sloka of the Madhava Nidana, 20th chapter. Due to the Nidana Sevana, there will be a vitiation of the Ama and Vata along with the Rasadhatu, takes seat in the Trikasandhi and produces the Sabdata of Sharira and Gatra, is called as the Amavata. Samprapti, Ama becomes the Vidagdata and enters the Damani, vitiated by Vata, Pitta and Kapha, causes the Shrota Abhishyanta, leads to the Pichilata and Nanavarnata. Next, Samprapti Ghatakas are like dosha, that is the Vata is Vana and Samana, Pitta is Pachaka Pitta, Kapha is Kleshaka, Dusha is Rasa, Meda and Majja, Upadatu is Siras, Snayu and Sandhi, Sharirika Mala is Purisha, Dhatu Mala is Kapha, Agni Jatar Agni and Dhatvagni. Agni Dushti is Mandagni and Ama Agni Janya. Shrotas are Annava Shrotas and Astivaha. Shrota Dushti Prakara is Sangha, Udbhavasthana is Amasha and Pakvashaya. Sancharasthana is Annava Shrotas and Dhamani. Adhisthana is Kafasthana like Sandhi and Amashaya. Vektasthana is Kafadhatu and Sandhi, Amashaya and Uras. Swabhava is Kastasadhya and Roga Margas are Madhyama. Next, the concept of the Hetus. The Amavata Nidanas are Viruddhahara, Viruddha Chesta, Mandagni, Vyayama after Tikta Bhojana, and Nischalatva. Why Viruddhahara is causing the Amavata? Because here Acharya Charaka has explained the 18 Viruddhas. They are opposite to the Dehadatus. Food or medicines which is ingested and causes the aggravation of the doshas, but not expel the doshas out of the body, called as the Viruddha. So here Viruddhahara has the properties like similar that of the doshas and the Dhatu Vigunata, that which is leading to Shrota Dushti. That which is remaining the Amashaya, the undigested Annarasa which forms the Agni Daurvalya, leading to the Ama. How Viruddha Chesta leading to Amavata? Sedentary habit of the exertion immediately after the intake of food, Diva Swapna, Ratri Jagarna, Ati Vyavaya, Vega Dharana, Shita Jalasnana in Shitakala and Ushna Jalasnana in Ushnakala, that which leads to the vitiation of the Agni, causes the production of the Ama. In the similar way, how the Mandagni is going to affect. They are explained 4 Agnis has been explained, that is Mandagni, Tekshnagni, Vishamagni and Samagni. Especially the Mandagni is considered as the root cause for the all ailments. That which helps in the responsible for the production of Ama and Vata. The Mandagni which production of Ama, that which is leading to the improper nutrition of the Rasadi Dhatus, that which is further production of the Malasanchaya Rupa of Ama, and due to Dhatvagni Mandya, the nutrition of the Dhatus leads to the Dhatukshaya, and further there will be a Vata Prakopa. Hence, the Jataragni and the Dhatvagni leading to the manifestation of the Amavata. How the Vyayama after Snigdha Bhojana leading to Amavata is, when Vyayama is done after the Snigdha Bhojana, that is responsible for the Shakagati of the doshas. That doshas will be the Prakopana of the Vata dosha. Then it will leads to the Agni Mandya, ends up with the Ama formation. How Nishchalatva? Here, the person who is lazy and less active in nature, such person consuming the Kafakara Aharas, that Agni becomes the Mandya, and for the sedentary habits, which is leads to the production of the Ama. Hence, the Vata dosha and the vitiated mood due to the other Nidanas causing to the Ama and leading to the Ama Vata. The concept of Linga, here the Purva Rupa, the Ayurvedic classics Purva Rupa of the Amavata has not been mentioned directly, but in Avyakta Lakshanas has mentioned in the Charaka Chikitsa 28 chapter 19 shloka. The Samanya Lakshanas are like Angamarda, Aruchi, Trishna, Alasya, Gaurava, Jwara, Apaka and Angashvanata. Pravruddha Lakshanas are like Rushchika Damshavat Vedana, Utsaha Hani, Vairasyata, Praseka, Daha, Bahumutrata, Kukshikatinyata and Shula, Nidra Viparyaya, Brahma, Chardi, Murcha, Ridroga, Vidvibandhata and Chadyata. Depending on the Doshanusara Lakshanas are like Vatanubandha, there will be a Sashula, and the aggravation of the Shula will be in the cold atmosphere and in the Ratri. And Pittanubandha, there will be Raga and Daha, and Daha will be surrounding in the Sandhisthana. Kafanubandha, there will be Saimithya and Guruta and Kandu. There is Sadhya Sadhyata that has been explained in the Samhitas like Madhavanidana, Vangasena Samhita, Yoga Ratnakara, Gada Nigraha, and Bhava Prakasha. They give the explanation of the prognosis of the Amavata that has follows. When there is a Ekadosha is there, that will be a Sadhya, and when there is a Dvidoshaja, that will be a Vyapya. And when it is the Sarvadehachara and Shota, that will be called as a Krutrasadhya. And in Tridoshaja condition, it will be Krutrasadhya. The concept of Aushadha, here I am taking the reference of Chakradatta. There, 25th chapter of Amadikara, he will explain the first sloka that Langana Svedanam Tiktam, Pipanani Katunicha, Virachanam Snehapanam, Bastayascha Ama Marute. Saindavadi in Anuvasasya, Ksharavasti Prashasyate. Langana Svedana Tikta Rasa Pradhana Dravya, Deepana Dravya, Katurasa Pradhana Dravya, Snehapana, Virechana, Basti, Saindavadi followed with the Ksharabasti has been explained as the Aushadha. Here, important formulations are like Satyadikwata, Erenda Taila Prayoga, Haritaki Prayoga, Nagara Churna, Vaishanara Churna, Rasna Saptaka Kashaya, Rasna Panchakola Kashaya, Yogaraja Gugullu, Simhanada Gugullu. These are the important formulation that will be used in the Amavata. Here, the Upashaya and Anupashaya has been explained. Yogaratnakara and Vaishajaratnavali Bhavaprakasha gives the Upashaya Aharas like Raktashali, Yava, Kulatta, Punarnava, Shrutashita Jala, Lashuna, Shunti, Karavellaka, Patola, Taktra, and Jangala Mamsa. These are the Upashayas for the Amavata. Anupashaya Aharas are like Navanna, Masha, Guda, Upodika, Viruddha Ahara, Matsya, Kshira, Dadi, Madhya, and Shita Jala. Conclusion. In Ayurveda, concept of Trisutra is explained for the maintenance and promotion of health and cure of the diseases. Trisutra knowledge is ultimate solution for every diseases and helps in the prevention of diseases like Amavata. To maintain the Samyavastha and the conversion of the Vishamavastha into Samyavastha, the knowledge of Hetu, Linga, Aushadha are essential. Nidana Parivarjana is considered as the first line of treatment in the Ayurveda. If the treatment is started at the initial stage, by proper observation lakshanas, we can do the Samprapti Vigatana and cure the patient. Aushadha includes the Ahara, Vihara, and Veshaja, which helps in the prevention of the diseases in future. Hence, all the concept of Ayurveda are included and briefly explained under the Trisutra, and which helps in a physician to analyze the diseases in clinical practice. Thank you so much. Thank you, sir.
Thank you, Doctor. So next I invite Dr. Mayuri Jagannath Dongre. I invite Dr. Mayuri Jagannath.
Next, I invite Dr. Pooja Sanjeev. Dr. Pooja Sanjeev, are you there? Dr. Pooja Sanjeev, are you there? Hello, Dr. Pooja Sanjeev. Okay. Next, I would like to invite Dr. Pallavi for the paper presentation. Sorry, poster presentation. Dr. Pallavi, are you there? Dr. Pallavi, are you there?
Yes, sir.
Okay, doctor. Your poster presentation topic is Varsha Guduchyadi, right?
Yes, sir.
Okay, doctor. Please start the session, doctor. Your screen is visible, doctor.
My screen. Okay, sir. Good evening, all of you. Hello. Am I audible, sir?
Audible, doctor. Audible.
Myself, Dr. Pallavi Vinayak Gote, MD final year student from Dravya Department of Shri Ayurvedic College, Nagpur, Maharashtra. This is a poster I had made on Varsha Rutucharya. I will explain all this in my slideshow. Poster presentation on Varsha Rutucharya. Introduction. Rutucharya is the ancient Ayurvedic practice and is comprises of two words, Ritu, which means season, and Charya, which means regiments or discipline. Rutucharya consists of lifestyle and Ayurvedic diet routine to cope with the bodily and mental impact caused by seasonal changes as recommended by Ayurveda. We get very special reference regarding description of 6 Rutus and categorization 3 Rutus each into 2 ayans, namely Uttarayan, that is Adankal, and Dakshinayan, that is Visargakala. Uttarayan and Adankala, it includes Shishir, Vasanta, and Grishma Rutu. Dakshinayan and Visargakala, it includes Varsha, Sharad, and Hemanta Rutu. Need to understand Rutucharya is Rutucharya helps us live according to the changes in season and make internal adjustments so that our doshas are in the state of balance. This is typically a wet rainy season. Season, monsoon and rainy, Marathi month, Shravan, Bhadrapad, month from mid-July to September, Bala, our lowest, Kala, Dakshinayan, Visargakal. Vata in Prakop state, Pitta in Sanchay. Strength of sun is Kshina and Rasa Utpatti is Amla. Characteristics, digestive fire is further weakened. This is typically a wet, rainy season with earth and fire energies rising to the forefront. Your Agni is heavily decreased during this. It is already weakened by summer, so it's time to get that fire roaring again. Water becomes Amla Vipaki. Cellular and humoral immunity is reduced in rainy season. The doshas gets aggravated by the effect of thick cloud full of water, cold air having snow, dirty water because of rain, warmth of earth, and so on. Hence, doshas start vitiating one another and causes many diseases. Do's, that is Pathya. Diet in Varsha Rutu or rainy season. Water available in the reservoirs during monsoon is comparatively heavy to digest and the metabolism is sluggish during this period. Water from deep well and boil should be used for drink. Drink boiled and cool water mixed with little honey. Use diet mixed with honey, ghee and oil. Bhav Prakasha states that consuming harit ki, Terminalia chebula, with rock salt in the monsoon season is beneficial to health. Consume light and fresh foods prepared from barley, shali rice, and wheat. All cereals, including cow's ghee, lean meat, green gram in daily diet. Meat soup, processed yush, soups of grains, also sour and salty soups of vegetables. Consume small piece of ginger with rock salt before every meal. Eat warm food and avoid eating uncooked foods and salads. Grape wine, asav, arishta, and fermented decoctions. Lifestyle in Varsha Rutu or rainy season. Only taking a healthy diet may not provide desired benefits unless supported by the healthy lifestyle. Avoid sleeping in the daytime as it hampers digestion and slows down the metabolism. Avoid overexertions and overexposure to the sun. Avoid moving out in the afternoon sun. Always keep the surrounding dry and clean. Do not allow water to get accumulate in surrounding. Keep body warm as viruses attack immediately when body temperature goes down. Avoid walking in dirty water during the rainy season. Keep your feet dry. If you happen to get wet, change into dry clothes as soon as possible to avoid getting infections as immunity is low during this season. Drying clothes with fumes of loban, that is dhoop, and drying leaves is also recommended. Also, perfume stay in the upper floor free from moisture and cold. Intermittent fasting is very beneficial. Don't and apatya. Avoid drinking and excess of cold fluid like mantha, beverages, cold juices, excessive liquid diet, impure contaminated water, as this further slows down the metabolism. Avoid consuming stale food, avoid leafy vegetables during monsoon, avoid curd, red meat, and any food stuff which takes longer time to digest. One may have buttermilk instead of curds. Avoid spicy and oily food can cause indigestion, bloating, and salt retention. Sleeping at daytime, exertion, and excessive physical exercise. Dinner should not be very heavy and should be taken 2 hours before bedtime. Recommended Ayurvedic treatments: Panchakarma, dry massage, that is Udvartan, Astapan Basti, Nasya, Svedan, Abhyanga, and Snehan. One should undergo Panchakarma therapies, reset yourself for the coming year and feel great. Common diseases: Amla Pitta, cholera, diarrhea, dysentery, skin diseases, fungal infection. Common interventions: Ushnodak with honey, Bilwadi Churna, Gangadhar Churna, Trikatu Churna, and Haridrakti. Thank you.
Thank you, doctor. So next I invite Dr. Prachi Sandosh Pandey. I invite Dr. Prachi Sandosh Pandey. for the poster presentation. Hello, Dr. Prachi. Dr. Prachi, are you there?
Hello. Yes, I'm here.
Doctor,
Hello.
you can start now.
Okay. Good evening, everyone. I'm Dr. Prachi Pandey, PG scholar from Department of Dravya-Yastimadhu Ayurved Mahavidyalaya. Today, I'm presenting a poster on topic Kesha Dravya-Yastimadhu. And this is my poster. I'll explain in further slides. In Ayurveda, hair are known as Kesh. Kesha means that is good for hair. Kesha Dravas in Ayurveda actually further classified into three groups, that is Kesh Sanjanan, Kesh Vardhan, and Kesh Ranjan. Khalitya and Palitya are two vyadhis described in Ayurveda. Khalitya means hair fall. Palitya means immature growing of hair. Acharya Charak mentioned Khalitya and Palitya in Shiro Rog, and Acharya Shushud mentioned it in Shudra Rogs. What is the reason behind Khalitya and Palitya? The main reason is actually is Pitta dominant Vyadhi, Pitta dominant Triyodoshas Vyadhi. Khalitya Vitiated Pitta along with vitiated Vard leads to weakening of withering of hairs from the hair root, and the other pathology goes along with this is it occurs because the Rakta dosh along with the Kapha dosh goes in the Rom Cooper, which causes the Rom Coop to close, which ultimately result in non-growth of hair from the hair follicles. And Palitya on the other hand is vitiation of Deha Ushma, and Ushna gun of Pitta circulates to Rom Coop and causes graying of hair. Around 40% male population and 25% female population in between age group of 18 to 14 years suffer from these diseases. Here, the aim of present study is to study the Kesha Dravya-Yastimadhu according to Ayurveda, along with the research done on its Kesha property, material and method. Information regarding the guna and karma of Yastimadhu is collected from Bhav Prakash Nighantu. Research work published in journals regarding Kesha property of Yastimadhu. Therapeutic properties of Yastimadhu. Its Latin name is Glycyrrhiza glabra. It belongs to Leguminaceae family. It is also known as Yastimadhuka, Madhuyashti, Madhuk Klitak. In Hindi, it is it can be identified as Mulethi. It is Vata Pitta Shamak. It is Madhur Rasatmak, Sheet Viryatmak, Madhur Vipaki, and its gun are Guru and Snigdha. The various karma of Yastimadhu are Chakshusha, Shukral, Keshya, Shothagna. The Prayojana of Yastimadhu is Mool. Normally it is the matra of Yastimadhu is 3 to 5 gram. And Yoga are Yastimadhu Kwat and Yastimadhu Tailam. How it can be used? For washing the hair, Yastimadhu Kwat can be used. And for and Yastimadhu Tail, like it can be used for Nasya in Khalitya and Abhyang to massage and Palitya. As Ras and Vipak of Yastimadhu is Madhur and Virya is sheep, it pacifies Pitta dosha, and its gun are Guru and Snigdha, it pacifies Vata dosha. By pacifying vitiated Pitta and Vata, Yastimadhu helps in reducing hair fall and graying of hair. The research is also conducted on it using Yastimadhu as a petroleum extract. Sukriti Upadhyay and associates studied hair growth promoting activity of petroleum ether root extract of Glycyrrhiza glabra in female rats. Observed that the rats showed significant hair growth. From the above study, it can be concluded that Yastimadhu promotes hair growth and stops graying of hair. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Vaidya Jajal for the paper presentation. Dr. Vaidya Rachana.
Yes, sir.
Okay, doctor.
Just a second.
Okay, doctor.
I'm not able to get my desktop. Yeah. Am I audible?
Yes, doctor. Audible.
Yes, doctor.
Yeah.
Your screen is also visible, doctor.
My name is Vaidya Rachana Jajal, PG Scholar Final Year, Sanita Department, PMT's Ayurvedic College, Shevgaon, Ahmednagar. My today's topic is role of Gugullu Tikta Kashay in metabolic disorders. Sorry. Gugullu Tikta Kashay, a wonder drug. The reference of Gugullu Tikta Kashay is Ashtanga Chikitsa Sthan, Dravya-Yastimadhu. This is the shlok of Gugullu Tikta Kashay, and the main 5 drugs are Nimba, Amruta, Rusha, Patola, and Kantakari. And so Neem, Vasa, Guduchi, Patola, and Kantakari. 480 grams of each is taken, and a coarse powder of it is boiled in 12 liters of water, reduced to 3 liters of kashay, and that is preserved. Later, 12 grams of each kashay from Patha to Yavani. These are taken 12 grams, and that is added later along with grit. 780 grams of the grit is added in the kashay, and Gugullu is added. So here, if you add ghee, it becomes panchatikta grit Gugullu, and if you don't add grit, it becomes tikta Gugullu tikta kashay. So we use it in the kashay form, and nowadays people prefer tablets. So Gugullu Tikta Kashay tablets are also available, and the dosage of tablet is 2 TDS, and the kashay is 5 to 10 ml before meal, once or twice a day. Anupan, the classical references are rock salt and jaggery, but I advised patient to take with normal warm water. Kashay tablets are also available, as I told, and this is the dosage. Here I am presenting 2 case studies. One is female of 67 years. She had pre-diabetes, that is her sugar was 120. Sorry, I forgot to write the date earlier when it was done. And later her FBS was done and it was 79.84 on 13 June. This was 2 months back. It was somewhere in, I think it was in March, 2 to 3 months back. The first, that is 120, it was in March. She came to me just in she came to me for treatment in April. So this is the first case study. She had raised fasting sugar and swelling and pain in ankle joint. Her FBS was 120. And after the treatment, her FBS was 79.48. Second case study, patient a 63-year-old female. She did not have any comorbidities, just fasting sugar raised and urine sugar was absent. In both the cases, the urine sugar was absent. The same for the for this female also. It was 120, the fasting sugar. That was also some, this is a recent case, just a month back. And after the treatment, the FBS was 101. And so now let us talk about metabolic disorders. What is a metabolic disorder? Metabolic disorder is a cluster of conditions that occur together, increasing the risk of heart disease, such like diabetes type 2. What is metabolism? We use the term metabolism when the body itself can reproduce, repair the damages, and respond to the environment. A metabolic disorder is a condition where the natural processes of the bodies are hampered. It impairs all these processes which are mentioned, that is reproduce, repair the damage, and respond to the environment. Is diabetes mellitus a metabolic disorder? Diabetes mellitus is a group of metabolic disorder, and it specifically hampers the carbohydrate metabolism. Diabetes mellitus is undoubtedly a fastest growing public health challenge of 21st century. India alone currently homes 69 million of diabetic people and is expected to double by 2040. Diabetes is an important public health menace from many perspectives, like it has a high morbidity, high mortality, it has a great economic impact, resource consumption is more because of diabetes, systemic complications individually, and silent but yet progressive nature. And it has less curative options. Like if you say diabetes is cured, we don't hear generally diabetes is cured. So it has very less curative options. A pragmatic way to deal with diabetes could therefore be its absolute prevention. So here we are today, I have taken this topic to highlight the pre-diabetic stage. That is absolute prevention by avoiding the risk factors, and selective prevention by getting alarmed of the warning signs during the pre-diabetic stage. So we intend to control the diabetes at the pre-diabetic stage. Such prevention in Indian context seems more worthy by knowing that India has 10% to 15% pre-diabetes prevalence. So the prevalence rate of pre-diabetes is 10 to 15% in India, with possibly the world's highest pre-diabetes, which converts into diabetes later. Now, what is pre-diabetes? Pre-diabetes is a condition where the blood sugar levels are high, but not that enough high to name it as diabetes type 2. So without intervention, if there is no intervention, then it can turn to diabetes type 2 within 10 years. Here it is the number which is given 10 years, but it can be converted from 6 months to 10 years. In anywhere in between, it can get converted from pre-diabetes to diabetes. Pre-diabetes is actually the stage of erratic glucose tolerance in response to food. Overtly, it is a subclinical condition marked only by subtle blood sugar level changes. Means there is a very little blood sugar level changes. Generally, we name it as pre-diabetes when the sugar goes above 126. Till 126, it is named as pre-diabetes. Also a bit higher, but have not reached to the level of qualifying to be called as diabetes. During this stage, there is no obvious clinical feature which may eventually be called as warranting or alerting signs, and which can actually help the patient to understand about the possible impending doom in the form of diabetes. Actually convincing a patient at a pre-diabetic stage is really difficult because they don't understand what are the consequences of pre-diabetes. Like, well, nowadays people are aware, they are health conscious. So on little bit counseling, we can make people understand. Now, causes of prediabetes. Causes of prediabetes are family history, genetics, sedentary lifestyle, overweight, excess weight, excess fat, diet, eating processed meat, and drinking sweetened beverages are associated with high risk. Understanding prediabetes. The cutoff of prediabetes is a fasting blood sugar of which ranges from 100 to 126, as I told earlier. These are diagnosed as prediabetes, and a fasting level of 126 and up is diabetes. And glycosylated hemoglobin, which ranges from 5.7 to 6.4 is prediabetes. My first patient, Mrs. Keeta, she had the HB1AC was 6.2. So she was exactly called as pre-diabetic. What is contemporary treatment for pre-diabetes? What contemporarily what is given to pre-diabetic patient? If not going for Ayurveda or homeopathy, then what does the patient take? Generally, they go for acarbose, alpha glycosidase inhibitors. Acarbose can improve the glycemic control in adult, self-care and nutrition. Now concentrating on prediabetes, how the prediabetes may be prevented from being converted into overt diabetic. To find a strategic reply to this question, there is a need to understand prediabetes as in Ayurveda. Working on prediabetes is a need of hour. Since years, globally people are working on diabetes from decades, but still it is under research. Hence, we should change the approach. Try concentrating on prevention and not letting it get converted into diabetes. Prediabetes. We all know that in prameha, cough and pitta gets vitiated, and thus occurs medavaha srotodushti, which increases the kledh in the body. And this kledh is then channelized to basti and causes excess urination in an individual. A disease is not a day process. In favorable condition and season, it exhibits itself, but it exists in a subtle state in an individual. We consider as Medavaha Srotodushti already present in pre-diabetic individual. Medavaha Srotodushti, we consider that it is already present in pre-diabetes, right? We presume that since there is Medavaha Srotodushti, so kledh is already present. We presume that kledh is also present in pre-diabetic, because we have to do the presumption, because there are no ways by which we can like diagnostic test by which we can know this thing. So presuming that the kledh is present, like I have done the treatment of the patient considering that kledh is already present in her patient's body. The main 5 ingredients for Tikta ras, which has Tikta ras pradhan, that is Vasa, Guduchi, the Tikta dravyas which are used over here, they have Laghu and Ruksha gun. These Laghu and Ruksha gun of this Tikta dravyas causes the upashoshan of the kledh and vikrut med. It controls the further vilayan of Meda dhatu. At pre-diabetic stage, the kledh and vikrut med are at a level of control, hence can be controlled. This is all presumption, because since it is just a hypothesis, like how I got the result, like in Gugullu, by giving Gugullu Tikta Kashay. The Tikta dravyas act on kledh and vikrut med, and the pre-diabetic condition, the kledh and vikrut med may be in a controlled condition. That is why we got the result, right? Other dravyas which are mentioned in the Gugullu Tikta Kashay are taking care of the vitiated cough and the pitta. Hence, total combination acts on all doshas and doshyas, controls and redirects the cells to normalcy. Like now I have done the comparison, like should we use Panchatikta Krut Gugullu for patient, or we should continue giving Gugullu Tikta Kashay only? Because the classical text mentions Panchatikta Krut Gugullu, and what we have given to the patient is Gugullu Tikta Kashay. So for that, I have mentioned some few points that in pre-diabetic stage is a condition which is a Samavastha. Hence, the drug with Laghu Ruksha Gun is needed more, and ghee, Ghrita may not be digested in Samavastha and may not benefit the patient. This is just a hypothesis to do the comparative study of both the drugs and come to a conclusion that which drug is more suitable. Rather, we have got results with Gugullu Tikta Kashay, but it is just, we can take this as a further research. Clinical research can be conducted on comparing these two drugs. Response of patient. Both the patient responded very fast to the treatment within 2 months.
Dr. Rachana?
Yes.
You are exceeding the time limit. Be fast.
This is the last slide, ma'am.
Okay, please continue.
Yeah.
Okay, doctor.
Response of the patient, most important, both the patient did not have sugar in urine. So this was the main point. So we should rethink on this and concentrate on pre-diabetes to save the future generation. So our main target is to control the pre-diabetes, and we can save the future generation from diabetes. In future, screening can be done. The main point is that if we say the clade is present, so we can recognize that by doing the lipid test of urine. So this is one point which we can include in if the RCT is to be done in future. Understanding Prameha as pre-diabetic stage is a novel concept in Ayurvedic etiopathogenesis, while metabolomic parameters like lipid level in urine can thrust at the area of research to have a pre-diabetic screening method as high-risk population. This tradition-guided research can open up novel opportunities in traditional knowledge-inspired system biology and drug discovery to fight against diabetes. Thank you. Sorry for exceeding.
Thank you, doctor. So before going to the next presentation, dear participants, kindly follow your time limits. You have maximum of 8 minutes. Do follow it. And next, I would like to invite Dr. Anjali Chamoli.
Hello.
Hello, doctor.
Hello, doctor.
Hello. Good evening to all of you.
Good evening, doctor. Doctor, please share the PPT.
अब कर तेरा ऑडियो ऑन कर क्लिक करवा बस बस यहाँ पे प्रेजेंटेशन होता है ना प्रेजेंटेशन ऑनलाइन Hello.
Hello.
Yes, you are audible, doctor.
Myself, Dr. Anjali Chamoli. I'm MD final year student from Dravya-Yastimadhu Department of Shri Ayurvedic Mahavidyalaya, and I have prepared a poster and a PPT We can share. Okay, I'm having some problem. Okay, ठीक है. So my topic is preventive and curative role of Terminalia Arjuna in Hridrogas. And here, in the introduction part is Ayurveda is an ancient system of medicine, is the oldest systems in the world. There are many types of treatment and medicine described in Ayurveda, in which herbal drugs plays a vital role. Arjuna is one of them. Description of Arjuna is available in Charak Samhita, Sushu Samhita, and Astang Hridaya. The cardiovascular diseases, CVD or Hriday Rogas, is one of the most common causes of death worldwide. It accounts for 3% of mortality globally. WHO estimates that over 75 early CVD is preventable and proven improvement in lifestyle and diet modification, exercise, use of cardiotonic herbs can reduce the overall risk of CVD. Due to today's lifestyle and toxic food culture, the amount of LDL increases in human body, which causes coagulation of arteries, which leads to serious conditions like arteriosclerosis, which further leads to severe tachycardia and hypertension, etc., which ultimately causes CCF, stroke, and other cardiovascular diseases. CVD can be treated by medicine and lifestyle modification that are diet, de-addiction, exercise, and medication. So here is the drug review. The Latin name of Arjuna is Terminalia Arjuna Roxburghi, and the family is Combretaceae family. It is included in following ganas. Acharya Charaka had described it in Udat Prashmana Mahakashay. Acharya Shusha described it in Nyugradadi Kashay, Salsaradi Gana. Acharya Vagbhata described it in Veer Tarvadi Gana and Salsaradi Gana. The synonyms are Dhavala, Indradaru, Nadi Sarja, Nadi Sarja, Falguna, and Pandava. Therapeutic properties of Arjuna are this Tarasa Panchaka of this are Tarasa is Kashaya Rasa, Guna is Ruksha Lagu, Vaidya is Shita, Vipaka is Katu, Prabha, and with Prabhava it is Hridaya and Prabhava. So Doshagnata is Kapha Pittahara, Karma is a Vedna Sthapak and Garbha Sthapana. Indication it is Medohar, Mehahar, Hridaya, Bhagnasandhan, and Shramahara. Sorry. How Arjuna work as cardiotonic? Cardiotonic effect of Arjuna is likely to be mediated through the release of intracellular calcium ions. It has been found that Arjuna bark contains high calcium along with other organic acid and glycosidal substances. The bark of Arjuna is rich in coenzyme Q10. It protects LDL cholesterol from damage through oxidation. Coenzyme Q10 depletes with age, and as we reach our 50s, the heart muscles become weaker, resulting in high blood pressure and palpitations. Arjuna have antioxidant and hypercholesteremia effects. Terminally, Arjuna decreases platelet activation and may therefore possess antithrombotic properties. Terminally, Arjuna have shown the like activity as PGE2, where PGE2 protect the heart from IR, that is ischemia and reperfusion injury. And the discussion is PGE2 plays an important role in normal cardiac function, and it produces coronary vasodilatation and increase coronary flow. As in same researches, terminally Arjuna have shown the like activities as PGE2, where PGE2 protects the heart from IR injury. Arjuna also showed antithrombotic property and hypolipidemic properties, which confirms that it has both preventive and curative effects. Thank you.
Thank you, Dr. Anjali.
Thank you, doctor.
Next, I would like to invite Dr. Anoosha for the paper presentation. Dr. Anoosha, are you there?
Yes, I am there. Are you audible?
Yes, Dr. Audible, Doctor. Please share the screen, Doctor.
Okay. Is the screen visible? Does the screen visible?
Not visible, Doctor. Screen is not visible, Doctor.
Now?
Not visible, Doctor.
Wait.
Hello, Dr. Anusha. Do you have any problem with screen sharing, doctor? Hello, Dr. Anisha.
Yes, sir.
Doctor, do you have any problem with screen sharing, doctor?
Yes, sir. Now it's visible.
It is in sharing mode, doctor, not visible. It shows screen, now visible, doctor. Your screen is visible, doctor.
Now visible.
Yes, doctor.
Okay. Is it visible now?
Yes, doctor, visible. Please start the session, doctor.
Okay. Good evening, all. Myself, Dr. Anoosha Adiga, second year PG scholar from Department of Dravya-Guna, presenting on the topic Dravya Prayoga in Palitya under the guidance of Dr. Pradeep, Associate Professor and Head, Department of Dravya-Guna, SDM Hassan. Coming to introduction, Palitya or Palita is one among the 9 Shiro Kapalagata Roga as explained by Vagbhata. It is the condition where there is depigmentation of the hair occurring due to different causes. It is a Pitta Pradhanaja Tridoshaja Vyadhi. It is also a Rasavaha Sroto Dushti Vikara. It is one among the Shudra Roga as explained by Sushruta and Madhava Nidana. Coming to Nidana, if we classify Nidana as Aharaja, Viharaja and Manasika Nidana, all the Pitta Prakopaka Nidanas like Aharaja Nidanas like Ati Katu Amla Ravana Sevana, Ati Ushna Ahara Sevana, excessive intake of Kulatha Pinyaka and Harita Shaka Sevana, excessive intake of Takra and Dadi will be a cause for Palita Utpatti. And Viharada Nidanas are Ati Vyayama, Ati Vyavaya, Atapa Sevana, Ratri Jagarana. Important Nidanas mentioned under Palita Vadi is Kshoka, Shrama and Krodha. These are the important or Vishesha Nidanas mentioned under this disease. Coming to Samprapti, it is mentioned that Shoka, Shrama, Krodha Kritaha, Shariroshma, Shirogataha, Keshan Sadoshaha Pachati, Palitam Sambhavatyataha. That is, due to different Nidanas, there is increase in Ushmata of Pitta in the Sharira, Sthana Samshaya in Shiras, which leads to Kesha Pachana, that is called Palitya. Coming to types, there are 4 types mentioned by Sushruta, that is Vataja, Pittaja, Kafaja and Sannipataja Palitya. He also mentioned Shiro Rujodbhava Palitya as special one. According to Sharangadhara, there are 2 types of Palitya. They are Kala Niyata Palitya and Akala Niyata Palitya. According to Yoga Ratnakara and Bhela, there are only 3 Palityas mentioned based on 3 doshas. Coming to Lakshanas, Vataja Palitya Lakshana is Tad Vatat Sputitam Shyavam Kharam Ruksham Jalatprabham. The hair will be Ruksha, Sputita, Shyava and Jalaprabha. That is, hair will be thin, rough and it will be split. In Pittaja Palitya, it will be Sadaha Yukta. The scalp will be Sadaha Yukta and Pithaba. There will be grayish discoloration or gray depigmentation of the hair. In Kafaja Palitya, Kafat Snigdham, Vivradham Atimat, Sthulam Sushuklam. That is, it will be, even though there is depigmentation of gray or graying of hair, it will be Snigdha and Vivradham Atimat. It will be lengthy. And Sthula Shukla. The word Varna will be Shukla Varna. In Sannipataja, all the mixture of all the Lakshanas will be seen. The special type is Shiro Rujodbhava Palitya, where there is Vaivarna and Sparshanakshama, that is severe tenderness will be seen in the scalp. Coming to Chikitsa Sutra, Charaka explained it as Khalitye Palite Valyam Harilomni Chasaditam Nasya Style Shiro Vakra Pralepaischa Upacharet. That is, main treatment in Palitya includes, one is Shodhana in the form of Nasya, Bahya Chikitsa in the form of Shirobhyanga and Pradeha Pralepa, and Shamanaushadis can also be given, which will normalize Pitta. Coming to the topic proper, Dravya Prayoga in Palitya, it includes Nasya with Taila processed with Brahatyadi Jivaniya Dravya, Nilinyadi Taila Nasya, Shiradi Taila Nasya. Then paste of Mandura, Amalaki and Japa flowers are applied to hair before taking bath and helps in relieving from Palitya. The graying hair is taken out, and Dugdhika and Karavira pounded with the milk should be applied as snuff. Both of them remove graying of hairs. Nimba Taila is taken as Nasya for a month, keeping on milk diet. Tila, Amalaka, Kamala Kesara, Madhuka and honey paste is applied on the head, which promotes the growth of hair and also dyes them. Oil cooked with Bhrangaraja Swarasa and milk along with the paste of Madhuka is used as snuff, which elevates graying of hair. Oil Bhimba and Gambari separately taken as Nasya, which helps in relieving from Palitya. Oil should be cooked with milk and juice of Sairayaka, Bhrangaraja and Tulsi along with the paste of Yastimadhu and kept in a stony container, and it is used for external application. Oil extracted from Suryapaka from the seed kernels of Shleshmataka pounded in a Amla Kanji should be applied as Nasya and also as massage. And as a prevention method, Utpala is pounded with milk and is kept underground for a month. When this is applied externally, it helps in blackening and glossifying of hair. Coming to the Kesharanjana Yoga, specially mentioned by Bhaishaja Ratnavali, Trifala, Nilini Patra, Bhrangaraja and Loha mixed with Ajamutra, and this is used as Lepa. Dhatri, Amra Majja are used as Lepa, which helps in development of Snigdha Sthira Kesha. The formulations which can be used in case of Palitya are Taila, mainly Kashmiriya Taila, Yastimadhu Taila, Mahanila Taila, Nili Bhrangyadi Taila, Yastimadhu Taila. Leha, Amrita Ballataka Leha, Vati is Abhayadi Modaka, Lauharasayana, Surana Vataka, Datri Loha, Grita is Mayuradhya Grita, Maha Mayuradhya Grita, Asava Rajta is Narikela Asava. Commonly used formulations in day-to-day practice are Bhrangamalaka Taila, Datri Loha, Nili Bhrangyadi Taila, Vibhitakki Taila. Coming to discussion, Palitya is a disease caused due to increase of Bhrajaka Pitta, which leads to early or premature graying of hair. Even though graying is a natural process, because of excessive stress and other reasons, depigmentation of hair starts in the early age, which is considered to be Palitya. The main line of treatment is avoiding stress and using Pitta Shamaka Dravyas. As it is one of the Urdhva Jatrugata Vikara, Nasya or Shiro Virechana is the one of the best Shodhana Chikitsa. Bahya Chikitsa include Shiro Abhyanga, Lepa, and which also helps in preventing of graying of hair. Shamana Aushadhis, which pacifies aggravated Pitta, is also useful. Coming to the conclusion, Palitya is both Kalaja and Akalaja Vyadhi involving Pitta Dosha. It is the most common condition in present generation. Prevention is very important before its manifestation. Treatment can be planned according to dosha and level of pitta involved. Nasya, Abhyanga and Lepa are the common line of treatment practiced. References. I have taken the references are available in Charaka Samhita, Chikitsa Sthana Trimarmiya Adhyaya, Sushruta Kshudra Roga Nidana and Chikitsa, Ashtanga Hridaya Uttara Sthana, Shiro Roga Vijnani Adhyaya and Shiro Roga Pratisheda Adhyaya. Thank you.
Thank you, Doctor.
Thank you, Doctor.
So next we have a paper presentation. I invite Dr. Nisarga for the paper presentation.
Hello, Dr. Nisarga.
Hello, Dr.
Yes, sir, I'm there.
Doctor, your screen is visible, Doctor.
Yes, I'm audible, sir.
Yes, Doctor, audible. Please start the session,
Thank
Doctor.
you. Good evening, everyone. Myself, Dr.Nisarga.K.S, first year PG scholar from Dravya-Yastimadhu Department, STM College, Ayurveda, Hassan. My topic of presentation is effect of Mutra Sangrahaniya Mahakashaya in polyuria. So definition of Mutra Sangrahana Dravya is Atimatram Punaha Punascha Pravartamanam Mutram Sangrahanati iti Mutra Sangrahaniyam. Mutra Sangrahaniya Dravyas are those which does Mutra Sangrahana in excessive quantity and frequent urination condition. Acharya Charaka has explained Mahakashayas in 4th chapter of Sutrasthana, Shadvirechana Shatashtritiya Adhyaya, and the Dravyas in Mutra Sangrahaniya Mahakashaya are Jambu, Amra, Laksha, Vata, Kapitana, that is Shirisha, Udumbara, Ashwatta, Ballataka, Ashmantaka, Somavalka, that is Kadira. As the Mutra Sangrahaniya drugs are used in excessive and frequent urination condition, which in conventional science can be correlated to polyuria. So let's know about polyuria. Polyuria is defined as a persistent large increase in urine output, volume greater than 3 liters per day, usually associated with nocturia, where normal average urine output for adults is 1.2 to 1.5 liters per day. If it exceeds more than 3 liters per day, it can be considered as polyuria. And types with causes, transient polyuria. First type is induced or therapeutic, which is caused by ingestion of large amount of fluids, alcohol, tea, coffee, acidifying salts like citrates or tartrates, spices, large amount of sugars, administration of diuretics, high protein diet, and spontaneous polyuria due to nervousness or after a nervous attack like examination, neurasthenia, after an attack of epilepsy, migraine, asthma, angina pectoris or paroxysmal tachycardia, hydronephrosis with periodic emptying of renal sac, attack of malaria during the cold stage, during convalescence from fevers, diminution or disappearance of edema, post-anuric diuresis, crisis of chronic nephrosis, continued polyuria, wherein we know that most important presenting symptom of diabetes mellitus is polyuria, which is caused by raised plasma glucose, leading to increased tubular delivery, which then exceeds the resorptive capacity of renal tubule, leading to glycosuria. Central diabetes insipidus, which is caused by an abnormality of the hypothalamic hypophyseal tract. Nephrogenic diabetes insipidus, which denotes end organ failure, that is the inability of the kidneys to respond normally to available antidiuretic hormone. Osmotic diuresis, it's a form of polyuria in which large amounts of filtered non-reabsorbable solute gain entry to the renal tubules. So clinical approach of polyuria is we need to take detailed history about chief complaint like duration, volume and number of voids per day and night, fluid consumption, alleviating and aggravating factors, associated symptoms like polydipsia, urgency, frequency, nocturia and incontinence, medications and habits like diuretics, IV fluids, intake of caffeine, alcohol, salt and protein. Additional considerations like head trauma, post-obstructive diuresis, psychiatric illness, malignancy, diabetes, Addison's disease, renal failure. We need to ask about family history of diabetes, malignancy, nephrogenic diabetes insipidus, water diuresis, that is primary polydipsia, central diabetic insipidus, nephrogenic diabetes insipidus. We have to do physical examinations, that is evaluate the volume status, BP, pulse, skin turgor, urine output, evaluate for target organ failure involvement, that is retinopathy, neuropathy associated with diabetes, evaluate for malignancy like lymphadenopathy, cachexia, palpable masses. We have to do kidney examination to assess for enlargement, neurologic examination to rule out encephalopathy or mass lesions, genitourinary examination to check for penile, testicular, scrotal, prostate, and vulvar or adnexal masses. And the complications of polyuria are, it may lead to hypovolemia due to excessive water loss, rapid changes in serum sodium concentration leading to neurologic manifestations, dilation of the bladder, ureters, and kidneys. Diagnostic evaluation of polyuria is, we have to do general tests like serum sodium, potassium, calcium, glucose, total protein, etc. Urine test like glycosuria, 24-hour urine specimen, urine osmolality, and specific tests of ADH function like water deprivation test, plasma vasopressin level. Imaging studies have limited scope in polyuria. So we till now we know about polyuria. Now we'll review on Rasapanchakas, Dosha Karma, main actions, useful parts of Mutra Sangrahaniya Mahakashaya. So Jumbo has Kashaya Madura Amlarasa, Lagu Rukshaguna, Shita Virya, Katu Vipaka. It is Vatakara, Kafa Pittahara, Sangrahi, Lekhana, Madhumeha Hari, Stambana, and fruit, seed, bark, leaf are the part used. Amra is having Kashaya Amlarasa, Lagurukshaguna, Shita Virya, Katu Vipaka. It is Kafa Pittahara, Mutra Sangrahana, Atisarahara. Fruit, leaf, and bark are the part used. Plaksha is having Kashaya Rasa, Guru Rukshaguna, Shita Virya, Katu Vipaka, Kafa Pittahara. It is Mutra Sangrahana, Stambana, and Vranaropana. Bark, latex are the part used. Vata is having Kashaya Rasa, Guru Rukshaguna, Shita Virya, Katu Vipaka. It is Kafa Pittahara, Mutra Sangrahana, Pramehagna, Yoni Doshahara. Bark, latex, leaf, root are the part used. Udumbara is having Kashaya Rasa, Lagu Rukshaguna, Shita Virya, Katu Vipaka. It is Kafa Pittahara, Mutra Sangrahana, Shvitragna. Bark, latex, and fruit are the part used. Ashwata is having Kashaya Madura Rasa, Guru Rukshaguna, Shita Virya, Katu Vipaka. It is Pitta Kafahara, Mutra Sangrahana, Rakta Shodaka. Bark, fruit, latex are the part used. Bhallataka is Katu Madura Rasa, Lagu Tikshna Guna, Ushna Virya, Madura Vipaka. Kafa Vatahara. It is Rasayana, Kushtagna, Mutra Sangrahana, and fruit is the part used. Ashmantaka is Kashaya Rasa, Lagu Rukshaguna, Shita Virya, Katu Vipaka. It is Kafa Pittahara, Mutra Sangrahana, bark, latex, fruit are the part used. Kapitana is Shirisha. Kashaya Tikta Madura Rasa, Lagu Rukshaguna, Anushna Virya, Katu Vipaka. It is Tridosha Hara. It is Vishagna, Kushtagna, and Sangrahi. Bark, seed are the part used. And Somavalka is Kadira. It possesses Tikta Kashaya Rasa, Lagu Rukshaguna, Shita Virya, Katu Vipaka. It is Kafa Pittahara. Kushtagna, Dantya, Mutra Sangrahana, and Heartwood is the part used. So the drugs in Mutra Sangrahana Mahakashaya are having Kashaya Rasa, which is Sangrahi, Shoshaka, Stambaka, Sharira Kledas Yopayokta, that is which absorbs the fluid, and Tikta Rasa, which is Mutra Shoshaka. These drugs possess Laguguna, which causes Malakshaya, Lekhana, and Rukshaguna, which causes Mala Shoshana, Stambana, and Tikshna Guna, which does Lekhana. Most of the drugs possess Shita Virya, which causes Stambana, and Katu Vipaka, which causes Baddha Vidmutrata. The Kapha Shamaka karma of these drugs leads to Mutra Kshaya, as Kapha and Mutra have Ashraya Ashrayi Sambandha. Coming to the conclusion, Mutra Sangrahana Mahakashaya consists of 10 drugs described in Charaka Samhita, Sutrasthana 4th chapter. The main purpose of these drugs is to restore normal quantity of urine, that is, which acts as anti-diuretics. Most of the drugs present in Mutra Sangrahana Mahakashaya has Kashaya Rasa, Tikta Rasa, Lagu Rukshaguna, Shita Virya, and Katu Vipaka, which causes Mutra Shoshana, Sangrahana, Stambana. Due to this, it absorbs the excess kleda from the body and helps to restore normal quantity of urine. So due to these properties, these drugs also have anti-diabetic effect, as the main lakshana of Prameha is Prabhuta Avila Mutrata. So these drugs can be effectively used in diabetes as well. And these are the references from which I have collected information. Thank you.
Thank you, Doctor.
Thank you, Dr. Nisarga.
So next we have a poster presentation. I invite Dr. Amrita. I invite Dr. Amrita for the poster presentation.
Okay, next I would like to invite Dr. Vishwakarma Anjali Gopal for the paper and poster presentation. Doctor, are you there? Dr. Vishwakarma Anjali Gopal, are you there? Hello, Dr. Vishwakarma Anjali Gopal, are you there? Okay, next I would like to invite Dr. Arunashree for the paper presentation. Dr. Arunashree, are you there?
Yes, sir. I'm there.
Okay, doctor. Please share the screen, doctor.
Yes.
Doctor, your screen is visible, doctor. Please start the session.
Good evening, everyone. Myself, Dr. Arunashree, first year PG scholar, Department of Roga Nidana Evam Vikriti Vignana. My presentation topic is Dadi as Karaka. These are my contents of the topic. Here comes the introduction. Ayurveda is science of preventive, promotive, and curative aspects in health system. The food pattern and lifestyle of people is rapidly changing in the present era of science and development. In this dietary shift, one of the major changes that have been seen is pattern of dadi consumption. Regular consumption of dadi is contraindicated in all samhitas. The ideal way of consumption of dadi, based on its qualitative properties and its adverse effect, are clearly mentioned by our acharyas, and same principles should be adopted in present day-to-day life. Acharya in Kilastana states that Nacha Ahara Samam Kinchit Baishajya Upalabhyate means Ahara plays a very important role than the medicine. Dadi acts as a Saneeksha Nidana and has a Vebhichari Nidana for the causation of disease. Dadi is one of the Kapha Prakopakara Karana Ahara explained by Acharya Madhavakara. Due to Samaya Siddhanta, Samana Guna acts as Vriddhi Karana. Also, one who doesn't follow Dadi Sevana Niyama, it shows risk factor in the formation of disease. Next, Dadi Gunas are Amla Paka Rasam Grahi, Gurushnam Dadi Vatajita, Meda Shukra Balas Veshma, Pitta Raktagni Shofakrit, Rochishnu Shasta Maruchau Shitake Vishamajvare, Pinase Mutra Krutchecha Rukshnam to Grahani Gude. The rasa of Dadi is Amla Rasa, Guru Sneh, Krishna Virya, and Amla Vipaka. It affects all Medas, Shukra, Bala, Kapha, and Agni, causes Vishamajvara, Pinasa, Mutra Krichra, and Grahani. The Manda Dadi gunas are Vidahi, Dahakaraka, Mala Mutra Dushtikaraka, Tridosha Nashaka, and Abhishandi. The types of Dadi are Maha Abhishandi Maduram, Kapha Medo Vivardanam, Kapha Pittakrit Amlam Syad Amlam Rakta Dushanam. It is Madhura, if it is of Madhura Rasa, it is Maha Abhishandi. Amla Dadi is increases Kapha and Pitta. Ati Amla Dadi causes Rakta Dushti. Semi-fermented Dadi causes Vidaha, increases stools and urine. Next, the Dadi Mastu. Mastu Klamaharam Balyam Lagu Bhaktabi Lashakrit Sroto Vishodana Ladi Kapha Trishna Nilapaham. Dadi Mastu is the supernatant portion of the Dadi, which is Klamahara, Balya, Lagu, and Sroto Vishodaka. As per Acharya Charaka in Sutrasthana, it described 4 types of Dadi is Mandaka Dadi, Jata Dadi, Dadi Sara, and Dadi Manda. Mandaka Dadi is Ganatva and Tridosha Karaka. Jataka Dadi is also Ganatva and Vatanashaka. Dadi Sara is Parisneha and Shukra Vriddhi Kara. Dadi Manda is Srotoshodaka. Dadi Sevana Niyamas are Na Daktam Dadi Bunjita, Na Chapya Grita Sharkaram, Na Mugda Supana Kshaudram, Na Ushnam, Na Amalakanvita. Avoid at night after heating in Vasantarutu, Grishma, and in Sharadrutu. Should be taken along with Grita, Sharkara, Mudga, Yusha, Kshaudra, and Amalaka. If it is taken along with Sharkara, Trishna, Daha, Nivarana. If it is taken along with Mudga, Yusha, it relieves Vatahara. If it is taken along with Kshaudra, causes Alpadosha Nivaraka. Taken along with Dhatri, it reduces Pitta and Raktadosha. Chart of Dadi described by Brihatrahi. In Charaka Samhita, Dadi, Virya of Dadi is defined as Ushna, Amla Vipaka, Vata Shamaka, Guna as Rochaka, Deepaka, Vrishya, Smehana, Balavardhana, Rogagnata as Pinasa, Atisara, Karsha, Shitajvara, Vishamajvara, Aruchi, Mutra Krichra, Rogakaraka as Rakta, Pitta, Kafaja, Vikaras. By Sushruta, it is of 3 types based on Rasa, Madura, Amla, Atyamla, Kashaya, Anurasa, Madura Vipaka, Dosha as Vata Shamaka, Pitta Vardaka, Kapha Vardaka. Guna is of Snidda, Ushna Virya, Deepaka, Balavardaka, Ruchipradam. Rogagnata as Pinasa, Vishamajvara, Atisara, Arochaka, Mutra Krichra. Rogakaraka as Kapha Meda Vivardanam and causes Rakta Dushana. As per Ashtanga Hridaya in 5th chapter, it is Amla Rasa, Amla Vipaka, Vata Shamaka, Pitta Vardaka, Kapha Vardaka. Guna as of Grahi, Guru, Ushna, Meda, Shukra, Balakrit. Rogagnata as of Aruchi, Shita Jvara, Vishama Jvara, Grahani, Mutra Krichra, and Pinasa. Rogakaraka as Rakta Vikara, Agni Dushti, Shota, Visarpa, Kushta, Pandu, and Brahma. Dadi as Hetu. Dadi acts as a Hetu in the following diseases of Nijashota, Rakta Dushti, Visarpa, Kafaja Gulma, Pramiha, Kushta, Sleshmodara, Ashas, and so on. From all these chat, we come to a conclusion or findings that Pathogenesis of Kushta and Agni Vikara are more relevant to Dhadi Guna. Disease pathogenesis of Shofa, Visarpa and Kushta are more relevant to Dhadi Karma. Kushta has the highest relevance for Guna and Karma of Dhadi. Here part of the discussion is disease pathogenesis occurred by Dhadi. Occurred by intake of Dadi is Shota. Types are Sarvanga Ekanga, Abhyantara Bhaya, Eka Marga and Bahu Marga. These differences is based on Guna. From Guru and Snigdha Guna intake of Dadi causes Kaphavruddhi. Due to this, Kaphavruddhi causes dosha. The Sanga Strota Dushti, dosha Udhirnana takes place, causes Swatantra Kafaja Shota. By the intake of Ushna Guna of Dadi causes Pitta Dushti, Uttarottara Dhatu gets Vilayana, effects on Tvak, Mamsa and Rakta, Stroto Avarodha takes place, causes Avarodha Janya Shota. All this, we come to a conclusion that Ahara plays more important role than the medicine. Food can build up or repair the tissue, protects against disease, or supply material to produce health and energy. Dadi Sevana is one of the major Nidhana Sevana in today's scenario. Ushna Guru and Ushna Guna are more relevant to disease pathogenesis. Mahabhishandi, Vidahi, Rakta Dushna Karanas are more relevant to disease pathogenesis. Pathogenesis of Kushta and Agni Vikara are more relevant to Guna of Dadi. Disease pathogenesis of Shofa, Visarpa, Kushta are more relevant to Karma of Dadi. Study of Dadi will be helpful for all to found Apatya and Patya of disease in which Dadi can or cannot be taken. Thank you.
Thank you, Doctor. So next I invite Dr. Manushree for the paper presentation. I invite Dr. Manushree.
Yes, ma'am.
Doctor, please start.
Yes, ma'am. Ma'am, is the screen visible?
Yes, Doctor.
Yeah, good evening, everyone. Myself, Dr. Manushree, first year PG Scholar, Department of Roga Nidana, Ayurveda Mahavidyalaya, Hubli. Today I will be talking about Nadi Pariksha diagnostic tool. Now, coming to introduction, in Ayurveda, we have studied two hypotheses like Pinda Brahmanda Nyaya and Amshamsha Kalpana. As per Amshamsha Kalpana, all elements found in the organisms are found in the seed of that organism in the minute quantities. The presence of pulse at Angushta Mula is evidence of life. Astagate Nadi Sarva Rogan Prabhashyate. Nadi Pariksha is done to analyze and estimate the quantity of tridoshas and body. And it has been quoted in Yoga Ratnakara as Dosha Kope Ghane Alpecha Purvam Nadi Parikshecha Antecha Adaut Sitistasya Vigneya Bishajasputam. In the final stage or in an initial stage, one should examine the Nadi of the person by the Bishak. It's one of the main tool in diagnostic feature as it has been mentioned under Ashtasthana Pariksha. So it gives the shortcut diagnosis of the diagnosis of the disease. Now, similarly, it has been mentioned in Yoga Ratnakara is Yatha Veenagata Tantri Sarvatran Prabhashyate Tata Astagata Nadi Sarvatra Rogan Prakashayit. Like how each and every tantri of Veena is representing its own sound or musical tone in the same way the nadi which is present in hasta is representing the roga of that, and like doshic predominance of that particular roga in this person. And importance of this nadi pariksha is nadya mutrasya mala jivya lakshan yona vidanti bharayatya ashu Marayati asho vaijantu sa vaidyo na yasho bhajet. Like one being bishak, one who does not diagnose nadi, mutra, juha, and etc. in a patient, he will be he will pulling the patient into mrityu, or he will be misdiagnosing the things. Now, how to diagnose? Like Angushta Nadi should be diagnosed in Angushta Mooladharha of the left hand in female patient and right in the male patient. Like it should be diagnosed in the same way. And it has here Manas also plays a very important role of the Bishak, because one should have a stable mind without any other thoughts to diagnose the Nadi in a patient. Sthira Chitta has been mentioned, and it should be Prashanta as well. Now, after having this Sthira Chitta and Prashanta, one should palpate the Nadi of the patient and then diagnose the disease. The main reason for the disease to occur is the aggravated Vatadi dosha inside the body, either by Aita Sevana or not following the proper regimen. If one Vyadi is not treated, it becomes Nidana for other disease. Nidana Artakari Rogas. So, firstly, Vaidya should examine Nadi, Juha, Netra, Mutra, and then one should treat the Vyadi. Vaidya, who have no idea about the Lakshanas of Nadi, Jiva, etc., will surely mix the Rogi to die. Nadi Parisha should be just like Ratna Pariksha. It has been quoted, like it has been given so much importance even from the initial period. And in Purva Darshanas and all, it has been correlated, like Vata Nadi has been correlated to Brahma, Pitta Nadi has been correlated to Shankara, and Kapha Nadi has been correlated with Vishnu. Coming to Paryayas of Nadi, Snayu, Nadi, Tato Hamsi, Dhamani, Dharani, Dharaha, Tantuki, Jivana, Jnana, Shabdaha, Paryaya Vachakaha. These are the synonyms. Then Dosha Kopa Nadis, like what will they resemble? In our like Samhitas and all, we all know what they say, they will quote it as it is. Like in day-to-day life, what we elicit, they quote it as it is. In the same way, the Nadi has been, the Kopa of these Doshik Nadis has been elicited. Vata Nadi has been correlated with Jalauka and Sarpa, as they will be fast moving with rapid rhythm, rate and all. Pitta, Kaka and Manduka, because like jumping tendency is more. Volume will be more in all these Pitta Prakriti Nadis. Kapha, Hamsa and Paravata. These are comparatively mild, slow moving animals. Sanipata Lavatithira, Vidoshaja, Kadachit Manda, Kadachit Vega. Sometimes it will be fast beating and sometimes it will be feeble. Now, coming to contraindications, it has been stated like Sadhya Snatha, because here due to Snana, there will be vasodilation in all over the body and the circulation will be hampered in the inside the body. So at that time, if we elicit or if we palpate the nadi, we may not get any findings. Then Sadhya Bhukta, like when after eating, our blood circulation will be concentrated towards the stomach region, and the peripheral blood circulation will be hampered, and more of the blood volume will be concentrated towards the stomach. So the nadi cannot be felt easily. Then Sadhya Sneha, here Sneha means Shodhananga Sneha, and we'll be giving more quantity of Sneha for a person to take in. So again, it is Guru for digestion, more blood circulation towards the stomach, and peripheral blood circulation will be hampered. Like Shuddhartha and Prushartha here as in the volume, like rasa factor will be affecting here for Shuddhartha and Trishartha, which hampers the circulation of blood. The blood will be becoming thick, or watery content will be less. So we can't elicit any findings, proper findings, like we can misdiagnose the things while patient will be in all these stages. So it is has been told as contraindications. Then coming to Hasadya Nadi, and I have tried my best to correlate with modern diagnosis so that we can elicit better. Like Stitva Vahati, it has been elicited in left ventricular, left heart failure, aortic rigidity, Vyakula, aortic aneurysm, Manda, aortic valve stenosis, Ushna Vegavan in fever, Guru Ushna, carbon dioxide retention, Lagu Vegavan, severe hypotension, and MI, aortic stenosis, Chapala, pulses alterans like LV, left ventricular failure, Damaru, severe dehydration, severe congestive failure, Kampate Spandate Hatyanta, liver cirrhosis, thyrotoxicosis, and anemia. Shigra malopeta shitala, aortic stenosis, aortic insufficiency, Tivra Kadachit Shitala and Sweda. It can be correlated with water, hammer pulse, like AV fistula, alcohol consumption. Deha Shaitya, Mukashwasa, Tivra Nadi, acute exacerbation of asthma, cardiac tamponade, Mukhanadi Yada Nasti, Madhya Shitya, Klama, like transient ischemic attack. These all the conditions are chronic and not easily responding for the treatment, so it has been considered as Adhyanadi. Now, coming to pulse examination. Pulse is a wave generated at the base of the aorta and spreading along the arterial wall or to the peripheral arteries. Superficial, why only superficial? It is because it can be easily palpable. And the commonly we are palpating the radial artery because only because that it is having the radius as a bony base, so that we can easily palpate and elicit the volume, rate, rhythm, everything. Easily we can palpate. Then three fingers, index, like three fingers we have to use for the palpation. Index finger should be towards the heart, next middle finger, next the ring finger. Then proximally, which we are with proximal finger, we are checking the force of the pulse. Distally, we are to obliterate the black flow, obliterate the black flow, and rest all like volume and all is elicited with the middle finger. Now coming to the clinical examination, right? Like what all the factors we are eliciting in a pulse examination is the rate. What is the like a heart rate and pulse rate should be same. It is well known to everyone. We are eliciting the rate by palpation. If like we can by this we can diagnose either it is tachycardia, bradycardia, or something like that. Then rhythm, at what speed it is bouncing, like pulse is beating, we can elicit like arrhythmias, cardiac arrhythmias can be elicited just by seeing the rhythm of the pulse. Sinus arrhythmia are most common in children, but as the age goes on, vagal tone improves in adulthood, and thus the cardiac like sinus arrhythmia decreases. Then volume. Volume is fairly palpated with the middle finger as by obliterating the arteries with proximal and distal one. By eliciting this, we can know about the good amount of blood will be present in the body. Then force. By force, we can elicit the systolic blood pressure of the person, and the tension. Here we can elicit the diastolic blood pressure. Equality on both sides, like we have to palpate simultaneously both the hands of the person, like individual by both the hands of the bishop, and by both the hands palpation should give the norm same to same simultaneously. They should beat like same rate, same rhythm, same volume. Everything should be there. Then condition of the vessel wall. As we all know, the arteries are elastic in nature, and by deeply by palpation, if we roll on the artery towards the bone, it should be elastic, smooth. If we are eliciting something like that, maybe it is a local examination, but still we can know about the atherosclerotic changes in the vessels. Then coming to peripheral pulsations, like we are eliciting a dorsal, other than radial, we are also eliciting dorsal, pedialis, temporal, carotid, etc. So these are the other areas of pulsation. Apex pulse ratio, as I stated above, heart rate should always be equal to pulse rate. There should not be any deficit. If there is any deficit, one hand should be kept in a apex of the heart and other should be used for palpation. Then while a few minute seconds changes will be there, because blood should come from aorta to the periphery. It needs few time, but if it's leading more like some beats are missing, then it indicates pulse deficit, and it's a major condition which should be diagnosed further. Now, coming to the device which can be used for the pulse examination, like sphygmograph. It's called sphygmograph. Pulse can be recorded in a graph with computerized instrument. Positive wave ventricular systole. Positive wave indicates ventricular
Excuse me,
systole.
doctor.
And yes, ma'am.
Kindly try to follow the time limit.
Yes, ma'am. Last slide, ma'am. Now, downstroke indicates ventricular diastole. Dichrotic notch is closure of aortic seminal and nerves. Tridoshas can be objectively compared here. Now, coming to conclusion, Nadi Pariksha has been said as one of the Ashtasthana Pariksha. It is an easy tool to arrive at the faster diagnosis. The traditional parameters are very much closer to modern parameters in this Nadi Pariksha. There's a need for extending the recent advancement in pulse measurement techniques and instruments to develop the framework for Nadi Pariksha and bring scientific approach to pulse-based diagnosis, which is a need of our. Thank you. Thank you.
Thank you, doctor.
Thank you.
Dear participants, again, I would like to remind the time limit. You have maximum of 8 minutes for the presentation. Please, we don't forget that. So next, I would like to invite Dr. Shruti for the paper presentation. I invite Dr. Shruti. Dr. Shruti, are you there? So next I invite Dr. Anjali P. I invite Dr. Anjali P. for the paper presentation.
Yes, ma'am, I'm here.
Doctor, please share the PPT.
1 second, ma'am.
Doctor, please start.
Ma'am, I think there is a few problem with sharing the screen. Let me check it.
Okay, doctor. Please try again.
Okay. Ma'am, I think there is few problem with connecting the screen.
Doctor, you can present later.
Okay, when will be the time?
Please be there.
Okay, fine.
So next I invite Dr. Sitara RV for the presentation. I invite Dr. Sitara for the poster presentation.
Yes, ma'am. Hello?
Yes,
Hello?
doctor, you are audible.
Okay. Good evening, one and all. I'm Dr. Sitara, PG Scholar from Department of Shalya Tantra, Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today, I'm going to present the poster on the topic, Yogic Practices in Orthopedics. So mainly I have taken 4 asanas for this, that is Trikonasana, Tadasana, Bhujangasana and Paschimottanasana. So this is my poster and I'll go in detail about each of the asanas now. So as we all know, yoga since the time immemorial has been healing people. So it is not just a set of exercises, but an entire school of physical, mental, as well as spiritual awakening. So people who are suffering from orthopedic problems can also find help in yoga, as it helps to deal with the orthopedic problems and provide strong bones and a firm back, which means a good posture. So the first asana which I have explained here is Trikonasana. Trikona in Sanskrit means 3 means 3 and kona means corners and asana means posture. So Trikonasana means it is a basic standing pose in yoga that strengthens and lengthens the groin and hamstrings and which also opens the shoulder and stretching of the hips. The benefits of Trikonasana has been given as it stretches the spine and gives strength to the thighs, calves and buttocks, and it stimulates the spinal nerves and improves the flexibility of spine, corrects the alignment of shoulder, and also helps to relieve from backache, gastritis, and indigestion. It also reduces the stiffness in neck, shoulder, and knees, and it also stimulates the nervous system and helps in alleviating the nervous depression and strengthens the pelvic area and toning the reproductive organs. The next asana is Tadasana. In Tadasana, Tada represents mounting, and again, asana means posture or pose. So in short, it is also known as mountain pose and also known as Samasthiti. So it is an ideal position for those who are having weak back muscles and rounded back, as it can aid and restore the body's natural ailment. And the Tadasana helps in relieving from the sciatic pain, and the muscels involved are the low back muscles and stomach muscles, and it helps to strengthen the nervous system and aids to beat the depression. And it also helps in treating the Parkinsonism by gaining the lower body strength and improving the posture and the balance. Next is Bhujangasana. Bhujanga, as we all know, is cobra, and asana again refers to pose. So Bhujangasana is also famous as a cobra posture, and the posture is also involved in Surya Namaskar. So it is a heart opening and back bending that stretches the whole upper body and can relieve us from back pain and upper body soreness or tightness in our shoulder. According to Geranda Samhita, it has been given as Dehagni Vardade Nityam Sarvaroga Vinashanam Jagarti Bhujangi Devi Bhujanghasana Sadhanati. So this always increases the bodily heat and destroys all the diseases, and by the practice of this posture, the serpent goddess awakes. So it opens the chest and the shoulders and strengthens the diaphragm muscles. And it also regulates the mood and digestion since it targets the abdominal muscles, and it enhances the strength, balances the chakra, and activates our kundalini and increases the flexibility, and which relieves the sciatical pain. The next one is the Paschimottanasana. Paschimottanasana, as being given in Geranda Samhita, is as Prasarya Padhau Bhuvidhanda Rubo Sanyasta Bhalam Chitiyugma Badhi Yitnena Padhau Chudridau Karabhyam Yogendra Pedam Paschimottana Mahuti. So it is a typical yoga pose, which means seated forward bend pose in English. So in this pose, we will be folding the half of our upper body over the seated over the lower half. So here the word Paschim means west and Uttana means stretched out, and asana is a position. So the word Paschim doesn't mean the west side, rather it is suggested of the back of the body, and the behind of the body is referred to as Paschim here. So hence a position in which the back of the body or spine is stretched out is called as Paschimottanasana, that is forward bent pose. So it is a traditional simple Hada Yoga asana that has much colossal health benefits. So the forward bend involves the whole system of our body, along with very beneficial for growing kids to improve their height. The people who are bearing high BP and diabetes and get good health benefits from Paschimottanasana. So the uniqueness of this forward bend posture is that it stretches the whole entire body. The anterior body part is known as the east, as well as the posterior body part is known as the west. So Paschimottanasana concentrate on the back part of the body. Thus, this asana is is named as seated forward bend, also recognize the intense forward bend posture. Moving on to the benefits of this asana. This asana, since it stretches the hamstrings and the spine, it also includes the calves, gluteus, hip flexors, and the lower back muscles. So by performing the Paschimottanasana daily will help to massage and tone the abdomen as well as the pelvic organs. It improves the flexibility of back of the thigh, lower back, and relieve the hamstring muscle tightness. It stimulates the kundalini, spiritual energy, as at the bottom of the spine. So yoga is a process of boosting our energies and protecting our body against the health problems through the asana. So each asana is made up of specific step that focuses on a particular area of our body. Most of us, due to our lengthy work hours and sedentary lifestyle, fall prey to all kinds of orthopedic problems. So in that case, we can always seek help of yoga, and various yoga postures specially cure the postural defect and help the orthopedic related problems. Thank you.
Thank you, doctor. So next I invite Dr. Anjali. Dr. Anjali.
Yes, ma'am. Let me try to share the thing.
Hello.
Yes, you are audible, doctor.
Hello. Okay, ma'am.
Hello, doctor.
Hello.
Doctor, are you able to present
Am I
now?
audible?
Yes, you are audible.
But the screen is not being shared till now. That's a problem. You can call somebody else. It's okay.
Okay, doctor. So next I invite Dr. Pragati M for the paper presentation. I invite Dr. Pragati.
Yes, ma'am.
Doctor, please start.
Yes, ma'am. Hello, ma'am. Screen is visible.
Yes, doctor.
Am I audible?
Yes, doctor. Please start.
Yes, ma'am. I'm going to present the topic on an in vitro study to evaluate the Agnikarma of Arka Pushpa, that is Calstropis procera, against dermatophytes under the guidance of Dr. Nisarga.K.S Effect, Associate Professor, Department of Dravya-Yastimadhu, SDM College of Ayurveda, Hassan. So, introduction. So, diseases may result from invasion of body by external infectious organisms acknowledged as krimi. In Ayurveda, krimi can be compared with both microorganisms and macroorganisms. So dermatophytes are microorganisms commonly labeled under group fungus. According to WHO, the prevalence rate of superficial mycotic infections worldwide has been found to be 20 to 25%. Plants generally produce many secondary metabolites, which constitute an important source of microbicides, pesticides, fungicides, and many pharmaceutical drugs. So Arca, that is Calotropis procera, belongs to the family Asclepidaceae. It is an erect, much branched and perennial shrub or small tree, having Katu, Tikta, Madhurarasa, Katuvipaka, Ushnavirya, and Vata Kafara properties. So Acharya Bhava Mishra in Bhava Prakasha Nigantu explained that the Arka Pushpa has Crimigna and Kushtagna properties. This study was conducted to determine the Agnikarma of Arka Pushpa against dermatophytes. Materials and methods, source and authentication of the drug. So flowers of Arka was collected from the natural habitat of Krishnarajapete, Manda district, Karnataka. So authentication was done by Department of Dravya-Guna, Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital Hassan. So extract, aqueous and alcoholic extract of Arka Pushpa was done by Soxhlet extraction method. The 4 different concentrations, that is 3 microgram per microliter, 2 microgram per microliter, and 1 microgram per microliter, and 0.9 microgram per microliter of each extract were done by serial dilution method. Source and collection of sample. So the clinical isolates were procured by taking skin scraping samples from the edge of the lesion with sterile scalpel blade from OPD and IPD of Sri Dharmasthala Manjunatheshwara College of Ayurveda, Hassan. The scraping were collected in a clean fold of black paper. The collected specimens were brought to the microbiology lab of SDM College of Ayurveda and Hospital Hassan for identification and culture of fungal organisms. Culture and sensitivity test. Culture was done in Sabaror dextrose agar media, and sensitivity test was done by agar well diffusion method. So assessment was done like a clear circular halo, technically called as zone of inhibition, will appear around the well, indicating the absence of fungi. You can see in the diagram. The disc diffusion study was measured by following zones. So sensitive zone, moderately sensitive zone, and resistant zone. For aqueous, sensitive zone was 14 to 12 mm. For alcohol, 18 to 16 mm. And for moderately sensitive zone was between 10 to 8 mm. And for alcohol, it is 14 to 10 mm. The resistance zone was below 6 mm for aqueous extract and below 8 mm for alcohol extract. Observation and results. Among 25 samples, 16 were identified as trichophyton, 8 were identified as microsporin, and 1 was identified as epidermophyton. So the 3 microgram per microliter concentration of aqueous and ethanolic extract showed more sensitive zone compared to other concentrations in all the organisms. So here is the sensitivity graph showing sensitivity of aqueous and ethanolic extract of organism against trichophyton. Here you can see the 3 microgram per microliter shows highest sensitivity. In microsporum also, the 3 microgram per microliter in both the extract will show high sensitivity. So now coming to discussion. So dermatophytes are the group of fungus which have the capacity to infect the stratum corneum of the skin and keratinized structures such as hairs and nails with minimal immune response from the host. There are 4 types of krimi explained in Ayurveda. They are Bahya, Purisaja, Raktaja, and Kafaja, which are 2, 4, 6, and 8 in number respectively. Among these, Raktaja krimi are those which resides and travel in Raktavaha, Sira, and Dhamani. It produces diseases like Kushtha, like skin diseases. Shushruta explained that krimi along with Tridosha are involved in the causation of all types of Kushtha. So mode of action. Arka Pushpa possesses Katu, Tikta Rasa, Katuvipaka, and Ushnavirya properties, causes adverse environmental conditions which are contrary to the condition which require for the growth of krimi. So antifungal agents generally work by rupturing or weakening the cell wall of the fungus, leading to fungal lysis. So the tannins present in flowers of Arka
were believed to be act on skin infections by coagulating cell wall proteins. According to number of studies, tannins can be toxic to filamentous fungi, yeast, and bacteria. So, discussion experimental study. Trichophyton was the major causative organism than Microsporum and Epidermophyton. 3 microgram per microliter concentration of both aqueous and ethanolic extract of Arka pushpa showed better result in all the 3 organisms. The results of this study indicate that ethanol was the best extractive solvent, followed by water extract. Trichophyton was the more sensitive organism. So in Trichophyton, ethanolic extract showed maximum zone of inhibition of 21 mm in 6.3%, and of aqueous extract showed maximum zone of inhibition of 15 mm in 18.8%. In Microsporum, ethanolic extract showed maximum zone of inhibition of 17 mm in 12.5%, and of aqueous extract showed maximum zone of inhibition of 14 mm in 25%. So conclusion, the study showed concentration-dependent antifungal activity against dermatophyte obtained from clinical isolates. Among the different concentrations of aqueous and ethanolic extract of Arka pushpa with 3 microgram per microliter showed maximum zone of inhibition. So the ethanolic extract of Arka pushpa showed better antifungal activity when compared with the aqueous extract of Arka pushpa. Thank you.
Hello, doctor. Hello. Dr. Preeti. Myself, Dr. Ashwati from the panel. I'm just, it's what variety, which variety you had selected for the study, that white variety only? Arka? Flower?
Hi, yes, ma'am. Calotropis procera only. Procera is Rakta Arka.
Recta Arka. Okay. In both, no? So for the Madar variety and Recta Arka, both having that Crimicina property are telling, no? So you have selected that one, Procera.
Yes, ma'am. I have selected procera.
Okay. Thank you. Good study.
Yes, ma'am. Thank you, ma'am.
Thank you, Dr. Ashwati. And thank you, Dr. Pragati. So next we have a poster presentation, and I invite Dr. Manoj Chandar Boye. I invite Dr. Manoj Chandar.
Yes, ma'am. Hello.
Yes, doctor, you are audible.
Hello.
Yes, doctor, you are audible. Please share the screen. Yeah, it's visible now.
Okay, thank you, ma'am. Good evening, everyone. Myself, Dr. Manoj Boye, PG scholar, Comar Bhutta Department from SMB Ayurvedic College. Kalin Sanskar, according to Ayurveda and modern science. Komar Vruta is the one of the prime branch of Ayurveda. Children are also considered as the most vulnerable class of the society, as they are unable to express themselves, dependent on caretaker. The children need a special attention and nursing, as children are in a rapid continuous process of growth and development, physically and mentally. In Ayurveda, various acharya describe many types of sanskars, in which all these sanskara are performed since Vedic period, whether we conclude logic behind it or not, it has some importance in development of baby. In present era, there is a need to understand its effect on scientific basis and simply its concept to adapt this in society easily. And we got the ideal baby for this society. Hence, word sanskara suggests concept of a growth and development and examination of a developmental milestone of a growing child. Introduction. Sanskaro hi gunantara dhanam. Any process which brings continued positive changes in a given material, dravya, physical, body, sharira, intellectual capacity, mana, and the personality, atma, is called sanskar. In medical science, sanskar can be defined as addition of a new qualities, skillful activities, bringing fitness, self-productive and impressions creating qualities, etc. Relation of a sanskar with growth and development. In pediatrics, we have two words with respect to maturation of a body, that is growth and development. Sanskara starts from conception and continue till death. Some as development. In child, many sanskara are performed at a particular age to assess rechecks that age and announcement of a developmental status of the child to all family members from time to time. Sanskar which can be performed in today's era described in Ayurveda literature are as following, which are divided into three avasthas of life. Garbha avastha. In Garbha avastha, there are three sanskara: Garbhadhana sanskara, Punasavan sanskara, Simantana sanskara. Second one is Balya avastha, Jatakarma sanskara, Namakaran sanskara, Nishkraman sanskara, Annaprashan sanskara, Chudakarma sanskara, Karnavedana sanskara, Upanayan sanskara, Vedarambha sanskara. And third one is Yuva and Vardhakya avastha, Samavartana sanskara, Vivaha sanskara, Vanaprastha sanskara, Sannyasa sanskara, Antishti sanskara. Importance of some sanskara, their modern aspect in present era. First one, importance of Jatakarma sanskara. This provides opportunity to examine the baby immediately after birth. Primary immunization done by giving Suvarna Prashna. It also helps to check initiate sucking, rooting, and swallowing reflexes which should exist in coordination. Importance of Namakaran Sanskara. Naming of the baby usually occurs on the completion of a 10th day, 11th day, 100th day, and 1 year. The name is decided astrologically on the basis of the time and place of the birth of the child, which is indicate social and communicable condition in society, has its impact on the person throughout the life by indications. Identifications. First 10 days are considered as a high risk period of newborn. Baby can die within a week in case of major congenital abnormalities, severe birth asphyxia, etc. So after completion of this period, Namakaran Sanskar is advised. Importance of Nishkraman Sanskara. According to Nishkraman Sanskar, the child is taken out of the house for the first time. After completion of 4th month, baby taken outside and usually gets exposed to a strong rays of the sun. Hence, disappearance of the physiological photophobia and complete development of eye and vision are the important criteria for the external exposure which will be attained by this time. So in Nishkraman Sanskar. Importance of Annaprashan Sanskara. Dugdha, Dugdapana in the first month, Phalaprashana in the sixth month, and Annaprashana in the 10th month. Suggest slow weaning from breast milk with an introduction of a family pad food system gradually. Secretion of pepsin, which are main digestive enzyme. Hence, at the time of 6 and 7 months, fruit juice, cereal water, rice water are introduced to the child. Allow vitamin C is helpful for absorption of iron and other micronutrients to place the child with a good digestive system. It may be helpful to produce urine and stool properly. This time baby starts sitting, scrolling, approaches objects with one hand and transfer to other hand. Importance of Karnavedana Sanskara. Piercing the earlobes in 6, 7, 8 or 12 months. This looks like an acupuncture method. Stimulation of adrenal glands reduces the respiratory infection. While piercing the ears, usually baby cries and vocabulary of the child can be indirectly tested, as by 7th, 8th, and 9th month, infant start verbalization word like ma, pa, da, ba, etc. Importance of Chudakarma Sanskar. Chudakarma Sanskar should be done according to Manusmriti in first year or max 3 to 5 years. According to Parashar Grahya Sutra, it should be done in first year. This is procedure adopted for examination of the skull, assessment of a bone growth of the cranium, and to identify the deformities of the skull at the age of first year. Acharya Sushruta says this procedure removes impurities, strength promoting, and bring delightfulness, lightness, prosperity, courage, happiness to the child. Acharya Kashyapa in Arunshika Chikitsa explained Mundan as the first line of treatment. That time confirmed diagnosis of a Fakka Roga. Importance of Upanayan Sanskar. Upanayan. Upa means near, Nayan means bringing. This sanskar performed before initiation of education on 5th year of age. This sanskar child will be sent to Gurukul, where he studies under the guidance of a teacher. He is educated to control his emotions, anger, aggressions, grief, and advised to behave maturely and responsibly. He is also educated to take care himself, parents, society. So these sanskar are important for personal and social achievements in futures. Conclusion: these sanskar are steps point of a life from where life enters in new phase. This sanskar establish maybe an atmosphere to accomplish with a situation. Each sanskar has its own value. Many times we can prove it by observing its effect, but also quite difficult to evaluate on the subjective parameters. All these sanskars are performed since Vedic period, whether we conclude logic behind it or not. It has some importance in the development of a baby. In present era, there is a need of understand its effect on a scientific basis and simply its concept to adopt this in society easily, and we got the ideal baby for this society. Thank you.
Thank you, Doctor. So next I invite Dr. Sanagala Priyanka for the poster presentation.
Yes,
I
ma'am.
invite Dr. Sanagala Priyanka.
Yes, ma'am. Ma'am, it's actually paper presentation.
Okay, Doctor.
Yeah.
Doctor, please share the screen, Doctor.
Yes, yes.
Okay, Doctor, your screen is visible, Doctor. Please start the session.
Am I audible, sir?
Audible, Doctor.
Okay. A very good evening, everyone. Today I'm going to present about clinical evaluation of Vaidya-Karma of Masura, that is Ervam Lenslin, on Vyanga, which is melasma, under the guidance of Dr. Nisarga.K.S, Assistant Professor, Department of Dravya-Guna, SDM College of Ayurveda and Hospital, Hassan. Coming to the introduction, Masura, botanically identified as Ervam Lenslin, belongs to the family Fabaceae, commonly known as Masoor dal or lentil. Apart from having Balya and Medohara property, Masura bija also possess Vaidya-Karma. Vyanga is mentioned under Rakta Pradoshaja Vikara by Charaka and in Kshudra Roga by Shushruta, which requires Vaidya-Karma. It is characterized by the presence of Niruja, Tanu, Shyava, and Varnayukta mandalas. Masura Lepa is one of the Varnya Lepa indicated in Vyanga, which has Masura as main ingredient, along with Shira and Grita. It is to be applied for 7 days. Vyanga can be correlated to melasma in modern terms. Melasma is a common acquired disorder of hyperpigmentation, which is characterized by irregular light to dark brown patches on forehead, cheeks, upper lip, and chin. These were the causes mentioned for melasma, being sun exposure as the main cause. So in order to provide an effective medicine in less duration with reasonable expense, the present study was taken. This is the classical reference for the study. Masurai Kshira Sampishtair Liptamasyam Gritanvitai Saptaratrat Bhavet Sasyam Pundarika Dalopamam. This reference was taken from Yogaratnakara and Bhav Prakasha Chikitsa Sthana. Coming to the objectives of the study, to evaluate the Varnya effect of Masura, Grita, Kshira Lepa on Vyanga, and to evaluate the Varnya effect of Grita and Kshira Lepa on Vyanga, to compare the Varnya effect of Masura, Grita, Kshira Lepa with Kshira, Grita Lepa on Vyanga. Coming to the materials and methods, source of the drug, the raw drug was procured from local market Hassan. Authentication was done from Department of Dravya-Guna, SDMCAH Hassan. Preparation of medicine. Masura bija was pulverized into a coarse powder and sieve, prepared in Department of Rasashastra and Vaishajya Kalpana. The powder of 10 grams each is packed in Ziploc pouches and neatly labeled with standard protocol before dispensing. This is the medicine sample. Masura Chuna, named as Lepa Chuna for Vyanga and Grita. Coming to the research design. Study design, it's an open label randomized comparative clinical study Sampling was done by simple random sampling technique, and sample size is 40 divided into two groups of 20 each. Intervention, Masura Lepa, that is Masura Kshira and Grita, and comparator is Kshira and Grita. Diagnostic criteria on basis of Lakshanas of Yanga like Mukamagatya Mandalam, Tanukam, Shavam, and Nirujam. Source of subjects attending the OPD and IPD of SDM College of Ayurveda and Hospital, Hassan. Inclusion criteria. Patients presenting with all Lakshanas of Yanga, female patients of age between 18 to 50 years, and patients willing to sign the consent form. Exclusion criteria. Individuals under treatment for any other skin problems and chronicity more than 2 years. Assessment. Based on texture and MASI, that is Melasma Area Severity Index. Here the formula was given. Here A denotes area of involvement, D is the darkness of pigmentation, H is homogeneity, and LM is left malar, RM is right malar, C is chin, and F is frontal. So these are the gradings for MASI for area, darkness, and homogeneity. And the picture you can see is the percentage for the area of involvement. Coming to the observations, total 49 patients were screened and 44 registered for study, and 40 have completed with 4 dropouts. Observations reveal that 52% of participants belong to the age group 30 to 40 years. About 89% of participants had exposure to sun rays as a physical aggravating factor. Moreover, 50% of participants were Vata Pitta Prakriti and 40% of Pitta Kapha Prakriti. 40% of participants had malar type of melasma followed by centrofacial type. Coming to the results. Results based on subjective parameters. Test for texture before treatment and after treatment for study group and control group. With the help of Maximus test, it showed significant changes in the texture of group A and group B with p-value less than 0.01. Among 40 patients registered, 12 in group A and 7 in group B had roughness before treatment, and their skin was smoothened subsequently. Results based on objective parameters. Unpaired t-test for MASI before treatment and after treatment for study group and control group. The mean MASI in group A reduced for the difference of 0.150. In group B, the mean MASI reduced for the difference of 0.161. The MASI score improvement was better in group A when compared to group B. Test for MASI before treatment and after treatment for study group and control group was done with the help of paired t-test, which was statistically non-significant, that is p-value greater than 0.05. Coming to the discussion, based on drug, the reference of Masura Lepa in Vyanga was taken from Yogaratnakara, which has to be applied for 7 days along with Kshira and Grita. Masura Bija has Shita Virya, hence pacifies the vitiated Pitta and also does Rakta Prasadaka Karma. Physiochemical evaluation. Masura showed presence of carbohydrates, proteins, and tannins in both methanolic as well as aqueous extract. Presence of flavonoids in aqueous extract. Phytochemical constituents. The seed shows presence of triacetin, luteolin, proanthocyanidins, ferulic acid, vitamin D, and lenticin. Discussion based on disease. Vyanga predominantly afflicts the Raktavashrotas. Acharya Shushruta mentioned Vyanga in second layer of Tvak, that is Lohita. Among various treatments mentioned under Vyanga, Bahit Parmarjana is taken for the present study as external application of drug in skin disorders is as important as internal medication. The skin color is created by special cells called melanocytes, which produce pigment melanin. The epidermal melasma is the most common type, where melanin is distributed throughout the epidermis. Topical treatment may work best in this type of melasma compared to dermal and mixed type. Discussion based on clinical study. On basis of observations, most of the participants registered in the study belong to the age group 30 to 40 years, had exposure to sun rays as physical aggravating factor, and are predominant of Pitta Prakriti with malar type of melasma followed by centrofacial type. All the above suggest that melasma is more prevalent in childbearing age and UV radiation has important role in causation of melasma. And melasma involves only specific sites and not the entire body. because melanocytes in the areas affected are more sensitive to hormonal stimulation and also due to greater population of melanocytes in the affected area. Coming to the effect on area, darkness, and homogeneity of lesion based on Marcy score, results were statistically non-significant. The drug Masura possesses ferulic acid and luteolin as active compounds, which inhibits the synthesis of melanin through the inhibition of tyrosinase catalytic activity, but it did not show any effect in 7 days, as melasma is a chronic disorder and the lifespan of melanocytes is more than 5 years. Coming to the effect on texture of the lesion, results were statistically significant with p-value less than 0.01. Among the registered patients, 30 had roughness over the lesion, and after completion of the course for 7 days, changes in the texture were observed. As the drug is given with Kshira and Grita, which has Guru and Snigdha Guna, they pacify the vitiated Vata, which is causing Rukshatva in Vata predominant Vyanga. Grita also has Vyavahi Guna, which helps in better penetration and quick absorption of the drug when applied topically. Probable mode of action: when Alepa is applied over the surface of skin opposite to the direction of hair through a proper base, the active principles of drug are released into the base. The drug enters the Roga and further gets absorbed through the Svedavahi Shrota Siramukha. Thereafter, it is subjected for Pachana by Brajakagni by virtue of Ushna Guna by Brajakapitta. This Ushma present in Lasika, Rasa, Rakta, Tvacha maintains the Dravatva in Rasa and Rakta, which in turn are responsible for Varna Utkarsha. So these are the pictures before treatment and after treatment. Coming to the conclusion, total 40 female patients with all symptoms of Vyanga were registered, among which 20 were from Group A, treated with Masura, Kshira, Grita, and 20 were from Group B, treated with Kshira and Grita. Both the groups were asked to apply the Lepa twice daily for 7 days. It is found that there was no significant reduction in area of pigmentation, darkness, and homogeneity, but changes in the texture are appreciable for the participants predominant of Ruksha Guna. Masura has luteolin and ferulic acid as active compounds, which were proven to inhibit melanin synthesis. By this study, it is understood that the drug Masura might be effective in Vyanga when it is used more than 7 days, as it possesses melanin inhibiting compounds. The study concludes that external application of Masura Lepa twice for 7 days showed no improvement in color of pigmentation, but changes in skin texture were noticed. Thank you.
Thank you, Doctor. So next I invite Dr. Basavarajeshwari for the paper presentation. I invite Dr. Basavarajeshwari.
Yes, ma'am, I'm sharing my slides.
Slide is visible, Doctor. Please start the session.
Am I audible, sir?
Yes, Doctor, audible.
Good evening, everybody. Myself, Dr. Basavarajeshwari B, second year PG scholar from Department of Roga Nidana and Vikriti Vignana, SDM College of Ayurveda and Hospital, Hassan. I'll be presenting the concept, role of Manasika Nidana in Ama Utpatti. These are the contents of the presentation. The holistic science, Ayurveda, has many basic set of principles. The concept of Agni is one among them, which plays a vital role in the maintenance of health of an individual. Rogaha sarve api mandagnav. Any changes in the Agni, or basically the Mandagni, is the main cause for the formation of Vyadi. How is Mandagni leading to the formation of Vyadi? It is by the formation of Ama. Ama is the pathological condition caused due to the change in the physiological state of Agni. Hence, the Vyadi also has Amaya as a synonym. The classification of Vyadi includes Sama and Nirama Vyadi. In the Ashtangradaya, Avabhasini Tika explains the relationship of Mana and Sharira with a simile, Taptacha Gateriva, which means when hot ghee is put in a pot, the pot becomes hot. Or when the ghee is put in a hot pot, the ghee becomes hot. Similarly, the Manas and Sharira the same relationship. Definition of Ama. Amyate ishat pachate, which means the partially digested food substance is called ama. Amyate pidate sroto samoha anena iti amaha. Ama is a substance which afflicts the srotas. Aharasya rasashesho yuna pakve agni lagavatam samulam sarvaroganam amam itya vidiyate. The ahara rasa, which is recemented in the stomach, incompletely processed due to agni lagavata, is called ama, and it is the main cause for the disease formation. Yatrastam amam virujyatam eva desha visheshena vikara jatau. The ama produces the vikara based on the desha vishesha. Samanya lakshana of ama. The Samanya Lakshanas include both the Sharirika and the Manasika Lakshanas. If we are to consider ama as a Sharirika Lakshana, then it also includes the Manasika Lakshanas, which specifies or signifies that there are the involvement of both the Manas and the Sharira in the formation or in exhibiting the Lakshanas of ama. Nidanas of ama. According to Charaka, the Acharya has explained Aharaja, Viharaja and Manasika Nidanas. The Manasika Nidanas include Kama, Krodha, Lobha, Moha, Irsha, Shoka, Mana Udvega, Bhaya, Tapta Manasa. Acharya Sushruta also explains the Aharaja, Viharaja and Manasika Nidanas like Irsha, Bhaya, Krodha, Parikshiptena, Lubdena, Shubdainya, Nipiditena, Pradvesha Yuktena cha Sevyamanam, Annam Nasamyak Paripakam eti. He has clearly explained that the anna which is taken will not be completely digested when the person is indulging in the nidanas as such. Why is Manasika Nidana to be given importance? Acharya Charaka explains, Matraya apyaba ritam patyam cha annam na jiryate chinta shoka bhaya krodha dukkha shaya prajagarehi. Which means when the person is taking matravatahara and patyahara, but still the lakshanas of ama persist in him, then we have to elicit the manasika nidanas in him, like the chinta, shoka, bhaya, krodha, dukkha. These manasika lakshanas should be elicited in a person by anumana ghamya bhava. These manasika bhavas are also called the dharanya vegas, dharana datavaha, which means the dharana vegas are the ones which have to be maintained. The incomplete or the incompetent maintenance of a vega will lead to the formation of vyadi. The sharira and manas dosha, which have impact on each other, helps in the formation of a vyadi. The manasika bhavas like shoka, bhaya, vishada have the involvement of raja and vata dosha. Bhaya, krodha, moha have the involvement of pitta, raja and tama dosha. Alasya, moha, ajnana have the involvement of kapha and tama dosha. The samprapti which can be elicited is when there is visheshan in the raja and tamo bhava of the sharira. It leads to the manasika bhavas like the kama, krodha, lobha. When these emotions or the manasika bhavas are under the physiological limit, it causes no disease. When it crosses the physiological disease, the samprapti can be elicited in two ways. One, in the direct or the indirect impact on the agni. The direct impact involves the agni mandya ama and leading to the vyadi utpatti. These manasika bhavas having or creating impact on the sharirika dosha leading to agni vaishamya, ama utpatti, and then the vyadi utpatti. The contemporary understanding can be taken like when there is emotional disturbance or a mental stress, this stimulates the sympathetic nervous system, which increases the adrenaline secretion and it inhibits the gastric secretion. This reduced gastric secretion leads to the impaired digestion of food, and strong stimulation of the sympathetic nerve also inhibits the motor activity of the gut, which leads to the stasis of the food in the stomach. The stress hormone serotonin produced by the gut bacteria gets increased as a result of emotional stress. It brings down the digestive power by inhibiting the gastric secretion. Thus, stress affects the gut-brain communication and trigger pain, bloating, and gut discomfort. Conclusion: Neurohormonal mechanism is responsible for the secretion of digestive enzymes and juices. Regulation of general metabolism is under the influence of psychological factor and vice versa. Hence, Manasika Nidana forms Agnimandya, leading to Ama and manifesting Vyadi. Take home message. Te cha vikaraha parasparam anuvartamanaha kadachit anubandhayanti kamadayo jvaradayascha. Thank you.
Thank you, doctor. So next I invite Dr. Shrikant Acharya for the paper presentation. I invite Dr. Shrikant Acharya. Hello, Dr. Shrikant.
Sir, ma'am, my screen is visible. Is my screen visible? Hello? Hello?
Yes, it's visible.
And audio?
Yes, you are audible.
Yeah. Namaste to one and all present. So today I will be, my paper topic will be, paper presentation topic will be effect of Krimigna karma of asana in the form of incense cones on vectors or dhoop cones on vectors. So my name is Dr. Shrikant Acharya. I've been guided by Dr. Prakash L. Hegde, co-author Dr. Ghazala ma'am, Ghazala Hussain. I'm a second year PG scholar from the college, STM College of Ayurveda, Hassan. So the aims and objectives of the study include conceptual study to evaluate the effect of karma of asana in the form of incense cones on vectors. Objectives include preparation of incense cone from kalka procured after preparation of asana thaila, to evaluate the Krimigna action vis-a-vis vector repellent action of asana dhupa. About Krimigna karma, concept of krimi in Ayurveda has been used on a broader sense. That means to say it includes all the organisms covering a wide range of infection infestation that include both the cause of the disease, for example, the malarial parasite Plasmodium vivax, also the carrier of the cause, that is the vector, the female Anopheles mosquito. For the prevention of these krimis, Rakshogna Vidhi has also been mentioned. One amongst them is Dhupana Samskara. Dhupana Karma is one of the Rakshogna Karma. In present day, we use synthetic agents to disinfect our surroundings. Incense sticks are prepared with chemicals that are hazardous to health. These customized dupe sticks can serve two purposes: combat microorganisms without producing adverse health effects while also emitting a pleasant fragrance. About asana, which is the drug that was used to prepare the dhoop cones. Asana, with the botanical name Pterocarpus marsupium, from the family Pterocarpaceae, is widely used in Ayurveda for treatment of diabetes mellitus. It is used as a rasayana for management of other metabolic disorders, including hyperlipidemia. Bhavaprakash Nigantu and Kayadeva Nigantu mention asana as Krimigna. Pterocarpus marsupium is a red-listed endangered species. The Kalka Dravya procured at the end of preparation of asana thaila has been used as the raw material for incense cones. So the materials that we have used is asana kalka, which is the refuse after preparation of asana thaila. Murchita Tila Thaila as the binding agent. The volunteers were students from Institution of Ayurveda. Methods: Kalka of asana fine powder was mixed with Murchita Tila Thaila to prepare incense cones. The cones were later burned to assess vector repellent effect, Krimigna karma, of asana. So to the top left corner, that was the Kalka refuse which was procured after the preparation of Asana Thaila. Asana Thaila was being prepared in the process for Ahiputana, which is one of the thesis works that one of my fellow classmate is preparing for her thesis work. A lot of drug was produced, a lot of waste was generated during the production of Asana Thaila, which would have been thrown. Asana being a red listed species, we were short of the raw material. So we thought, why not use it in the other way and give additional benefit to the patients here at the hospital. So this pilot study was taken, exploratory study was taken in order to estimate the effect of Agnikarma in the form of dhoop cones. So to the left side bottom, you can see the incense cones that was prepared after mixing the asana mixed with Muchitratila Taila. And to your right side is the asana that was being burned. Results and discussion. Study carried out showed that dhoop cones produced fumes of sweet aroma to inhibit level of contamination and risk infection. It also was slightly had an irritant property, which worked in repelling the vectors such as the mosquito. The incense cones formulated showed satisfactory degree of inhibition, along with advantages of these being non-toxic, economical, and easy to prepare. Thus, these can effectively replace the more hazardous methods of fumigation. For example, once this burn, they produce a flame slowly and they burn for a very long time. Thus, they do not produce any adverse effect on the patients who are taking the smoke. The same method could be used in case of preparation of other incense sticks to reduce wastage after preparation of medicines such as Murta Duta, prepared from the Kalka refuse after preparation of Murchit Thaila. Because again, Murchit Thaila is a very common drug that we use, but the raw materials that we use are still wasted in the form of Kalka for a very long time. So we could make it into Kalka form, and then we could produce it into dhoop cones. So the cost of raw materials play a major role in deciding the final price of the medicine. A lot of waste is generated at the end of preparation of medicine, which is discarded as refuse. So such novel methods could provide non-toxic, economical, and easy to prepare methods to handle this refuse. Like I said before, the cost of raw materials our medicines are quite costly for the consumer and also the producer. So as to cut the price, and also the raw materials are very precious for us. So as to cut down the price, we could use this novel methods to we could use such novel methods to save our natural resources. Conclusion is laden with impurities causing many diseases. Need for such easy and cost-effective measures to clean the air. Dhoop cones are feasible, effective, simple, and popular aids that could be promoted to improve public health. Methods as such above could also save a lot of natural resources that would otherwise have been discarded as waste. Finally, I thank the organizers of Sameeksha organization for giving me a platform to put forth my topic. Thank you.
Thank you, Doctor. So Dr. Ranganath has having flight at 9 o'clock. So let me allow to invite him next. I invite Dr. Ranganath E for the paper presentation.
One minute, please.
Hello, Dr. Ranganath.
Hello, sir. Is my screen visible, sir?
Doctor, please share the screen, doctor.
1 minute, sir. Is my screen visible, sir?
The screen is visible, doctor. Please start the session, doctor.
Oh. Good evening to everyone. Today, myself, Dr. Ranganath, I am from SSRMCA College in Karnataka. Today, I am going to present understanding the concept of Veshaja Pariksha Vidhi, which is relevant to standardization approach. Introduction. Ayurveda is a very ancient life science of India, pertaining to maintaining the health. The main aim of Ayurveda is to mitigate the removal of abnormalities of the sick. For achieving these benefits of Ayurveda, 4 limbs have been told in Ayurveda, that is Visha, Veshaja, Upasha, and Rogi. And it shows Veshaja is the main very important to treat the patients. Among Chikitsa Chatushpada, Veshaja is a medicament or drugs. Veshaja is essential in case of Dravya-Bhuta Ichthyopasya Chikitsa, and before using drugs, testing of Dravya is mandatory. Concept of Dravya Pariksha Vidhi. As per the description in Vimanasthan of Saraka Samhita, Acharya Saraka has given the guidelines for drug standardization. That is, the sloka goes like this: Idameva Prakrutyam, Gunamevam, Prabhutam, Asmin, Deshe Jatam, Asmin, Rutam Evam, Ruhitamevam, Nihitamevam, Upaskrutam, Manaya, Matra Yuktim Asmin, Vadavim Vividasto, Purushastai Vatavantam, Dosham Apakarshit, Upashamayati Va, Yadjan Yajati, Sa Vividam, Jesajam, Pavetutsanena, Visheshata Iktamiti. The meaning is value to the crude drug or raw drugs in each and every process right form. That is collection, purification, and preparation. Till preservation of the drug can be considered as standardization of the drug. Now we will see the Prashasta Veshaja Lakshana. That is Bahukalpam Bahuganam Sampannam Yogyam Vartana. How the drugs are collected and when it will be collected. Like that. In Atharvaveda, it has been mentioned that plant used as food and medicine should be collected in their fully grown stage. The plant under cultivation and plant growing in wild gets different light hour, that is Agni, soil condition Prithvi, and climatic condition, that is Vayu and water, that is Jala. It may foster a change in Mahabhuta composition and consequently alter the medicinal properties and values. That is Sangrahana Vidhi. First we will see the Sangrahana Vidhi. For example, Madanaphala, which is facing towards east and north and which is in fully grown state. After praying to every god, they have to collect the Madanaphala. And preservation. This means the samskar or some procedure to change the physical form or the quality of the material for use. There are the various procedures like cleaning, drying, processing, trituration, powdering, etc. Shodhana. Shodhana doesn't mean just eliminating the toxic components present in that particular drug, but also certain important factors can also be imparted in the drug, which is useful for the patients. Now we will see the how modern concept, how do we standardization of the drugs. A significant identification and examination of crude drugs is important in process of herbal formulation. In general, we will study like organoleptic and microscopic, physical, chemical, and analytical and biological. The organoleptic characters like moisture content, viscosity, melting point, solubility, refractive index, ash value, and extractive values. Need of pharmacological standards in drug standardization. Why you have to standardize a drug? Like drug evolution may be defined as a determination of identity, purity, and quality of drug. To decide whether it's pure or it's qualitative or it's purity, we will test the drugs. Like importance evaluation of crude drug, determination of biochemical variation in the drugs, identification of deterioration due to treatment and storage, reporting substituents and adulteration as a result, carelessness, ignorance, and fraud. So for these reasons, we will test and standardize the drugs. And lastly, the conclusion is the study of new drug by Dravya-Yastimadhu Charaka Samhita Vimanasthana would facilitate the inclusion into the Ayurvedic compendium. It is the most applicable for the study of Anukta Dravya, that is unknown drugs which have not mentioned in Ayurveda literature or folklore medicine. Application of therapeutics. If a drug studied according to the Ayurveda, it has very modern furniture, it would firm base its expertise in Ayurveda therapeutics. And now I conclude that before collecting and processing of preparing any medicines, we have to test the drugs according to Ayurveda and its modern conditions, standardization. Thank you.
Thank you, doctor. Next, I invite Dr. Preetishree for the paper presentation.
Ma'am, whether slides are visible?
Now, yeah, doctor, it's not
Not visible, doctor. Please
Not
try
visible?
again, doctor.
Okay, 1 second, sir. 1 second, sir.
Okay.
Now?
Not visible, doctor.
Sir, now?
Okay, doctor. Now visible, doctor.
Okay. Good evening, all. Myself, Dr. Preetishree, first year PG scholar, Department of Kriya Sharira, SGM College of Ayurveda, Hassan. My topic is Mutravaha Srotas. Contents goes like this. Introduction. Srotas. Sravanat Srotamsi. The structure through which Sravana or oozing takes place is called Srotas. Synonyms: Sira, Dhamani, Rasavahi, Nadya, Marga, Sthanani, etc. According to Charaka and Sushruta, types of Srotas are listed as follows. And coming to the Moolasthana of Mutravaha Srotas, Mutravahanam Srotasam Bastir Moolam Vangshanaucha. According to Charaka, Basti and Vankshana are the Moolasthana. Mutravahi Dvetayor Moolam Bastir Medramcha. According to
Doctor?
Sushruta, it is Basti as well as Medra. Mutra Karya, Mutrasya Kleda Vahanam. That is, the maintenance of the
Hello,
moisture
doctor.
is the. Yes, sir.
Doctor, your slide is not moving, doctor. It's in first slide, doctor.
1 second, sir.
Okay.
Actually, for me, it is moving.
Now moving, doctor.
Okay, I will just move like this only, sir. Mutra Karya. Shall I start with this? Hello? Hello?
Doctor, you are audible. Please continue.
Okay. Mutra Karya, Mutrasya Kleda Vahanam. That means maintenance of moisture. According to Ashtanga Hridaya, maintenance of moisture is the main karya of Mutra. According to Sushruta, filling of basti along with maintaining moisture is the function of Mutra. Kleda is moisture. As long as urine production and excretion is in normal limits, every cell in the body gets enough moisture to survive in homeostatic condition. Mutra Utpatti Krama. According to Sharangadhara, Ahara Rasa divides into Sara as well as Kitta Bhaga, and this Kitta Bhaga again divided into Mutra as well as Purisha. Through siras of Pakvashya, Mutra is taken into the basti, and there it is called as Mutra. Pramana is for Anjali. Dushti Karana, Mutrita Udaka Bhakshya, Stri Sevana, Mutra Nigrahat, Mutravahini Dushyanti, Kshinasya, Abhikshatasya cha. According to Charaka, when the urge of urination is present, at that time, if a person involves in drinking water, food, and having maithuna, as well as repeated Mutravega Dharana, excessive emaciation of the body or injury to Mutravaha Srotas leads to the Dushti. Dushti Lakshanas, according to Charaka, increased rate of urine flow, obstructed urination, Repeated urination but less in quantity, large amount of urine flow, and painful micturition are the lakshanas. Mutravriddhi. Mutram tu basti nistodam krute api akrita sanyatam. Pain over basti region, feeling of non-voiding even after micturition. This is according to Ashtanga Hridayakara. And according to Sushruta Samhita, increased urine formation, frequent urination, pain over basti region, as well as distension of the bladder are the Mutravriddhi Lakshanas. Mutrakshaya. मूत्रक्षये मूत्रकृच्छ्रं मूत्रवैवर्ण्यमेव च पिपासबाधते च अस्य मुखं च परिशुष्यति. Difficulty in passing the urine, discolored urine, thirst as well as mukashosha, that is dryness of mouth, are the symptoms according to Charaka. According to Sushruta, it is pain over basti region as well as decreased urination. Mutre alpam mutrayit krichrat vivarnam sasrameva va. Here, mutre alpam, in the commentary it goes like this. Mutre kshine alpam mutrayit. That means decreased formation as well as output is also less. Difficulty in voiding, discolored or mixed with blood. Coming to the discussion point. Basti, what is basti? Alpamamsa shonite abhyantarataha katyam mutrashayo bastihi. Sushruta explains as Basti is such as mama, it is having alpamamsa and alpashonita, which is present in Kati Pradesha and it is the ashaya for mutra. Dalhana comments over this. It is having, Basti is having ekadwara, tanutwak and adhomukha. According to Ashtanga Sangrahakara, Basti is the one which is having Alpamamsa and Alpashonita, which is present in Kati Pradesha, having Danu Vakra, Ekadwara, and Adhomukha. Mutrashayo Maladharaha, Pranayatanam Uttamam. That means the synonyms of for Basti is Mutrashaya as well as Maladhara, and also it is called as Shreshta Pranayatana. Dalhana comments as Mutrasha is also called as Maladhara and it is one among Pranayatana. Bastir Mutrena Puryate. Sushruta says in Nidhanasthana as Basti is filled with Mutra. Nisyandena Upasnehena Puryate. Dalhana states that mechanism by which urine is filled is called as Upasnehana. That means exudation. According to Sushruta Sharirasthana, prasadamsha of Rakta as well as Shleshma, which has been digested by Pitta with the help of Vayu, is going to form Antra, Guda as well as Basti. That means this is the embryological origin. Coming to the references of Vankshana. The word meaning of Vankshana is the groin, the pubic as well as iliac region. So most of the true ligaments are helpful for maintaining the position of the bladder, which have an essential role in the elimination of urine. True ligaments are related to pubic and iliac region. Puborectalis muscle supports the bladder as well as contribute in urinary continence. Medra is explained as mula. Urine is expelled out through urethra and in males it's through medra. As expulsion is through this prime organ, Sushruta has mentioned it as Mulasthana. Then what is Mutra Praseka? Mutra Praseko Nama Mutra Mena Basti Mukashrayena Srotasa Ksharati. Dalhana states that from Mutravaha Srotas, the channel through which expulsion takes place is called as Mutra Praseka. Mutrasrotaha parinaham mudgavahi dashangulam. Dalhana states that mudgavahiti antaschidраmanam dashangulam iti dairghena. Means circumference of the urethral opening is mudgavahi and the length is 10 angula, and this is pertaining to the male. Then what about female? Narinam chaturangale. That means in women it is 4 angula. Apatyamarge Purushendriya Sthulam. Dalhana states that Apatyamarga of Stri is Sthula when compared to Purusha. By this reference, we can conclude that urethral opening is different in females. Coming to the conclusion part, Mutra, Kita part of Ahara Rasa, which has to be eliminated through proper channel. The discussion regarding Basti, that is urinary bladder, which is reservoir of urine, collecting urinary fluid through Mutravaha Nadi. Medra, the penile part of urethra in male, and in females it is correlated with urethral part, which takes part to excrete out mutra only. On the above available references, it can be understood that in the ancient Ayurvedic literature, the concept of urinary system as an independent unit has been accepted. Thus, we can conclude that Mudraha Srotas is an important entity among all Srotas. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you.
So, Next, I invite Dr. Priyanka K for the presentation.
Dr. Priyanka K, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Sir, is this visible? Hello?
Not visible, doctor.
One minute, sir.
Okay, doctor. Hello, doctor.
Hello. Just a minute, sir. It is not visible.
Screen is not visible, doctor. You have any problem with screen sharing, doctor?
Wait.
Okay, doctor, don't worry. I will share for you, doctor.
Thank you, sir.
Doctor, please start the session, doctor.
Yeah, sure, sir. Good evening, everyone. Myself, Dr. Priyanka K, second year PG scholar, Department of Samit Siddhanta, AMU Hubli. Today's my topic is exploring Sushruta's view on Samvayetu Doshanam Puram Pittam Upacharit, Jware Chaiva Atisare cha Sarvatra Anyetra Marutam, guided by Dr. J.R. Joshi sir and Dr. Saurabh Kokatnur sir. In Ayurveda, doshas are the functional entities within the body-mind complex. These manifest in the body through their quality-specific sthanas and the active roles they play in coordinating the process that form and sustain the body. The pathogenesis and the prognosis of a disease also depend upon the dosha involvement. It may be ekadoshaja, dvandvaja, sannipataja, and its chikitsa also depend upon the specific or dominant dosha involved in the disease. Sushruta Samhita highlights the sutra Shastra Karma, but it also given equal importance to Shamana and Shodhana Chikitsa based on the dosha involvement. So here this shloka emphasizes the Pratama dosha Chikitsa in case of Samyogaja and Sannipataja Vyadhi. Ayurveda is a wisdom of life or the knowledge of longevity. Nidana Panchaka, Shadkriya Kala, Samsarga, Sannipataja, Anubandha, Anubandhya of the doshas are the core concept of Ayurveda to understand a disease. But applying it practically, we need to understand the dosha avastha along with the vyadhi avastha to give an appropriate treatment without aggravating the condition. The considered sutra elaborates the Pratama dosha chikitsa in case of Samyogaja and Sannipataja Vyadhi specifically in Jwara and Atisara and other diseases as well. The concept of Pratama chikitsa are opined by different acharyas in different way, but here the importance given to Sushruta's view on dosha avastha chikitsa in different diseases. The shloka elaborates, as in case of Samsargaja and Sannipataja Jwara and Atisara, we have to treat the Pitta dosha first. Other than these diseases, we have to treat the Vata dosha. But here comes the question, why? So for that, we have to understand the Samprapti of Jwara and Atisara first. Here we are dealing with first Jwara Samprapti. Doshaha prakupitaha sveshu kaleshu svaihi prakopanaihi vyapyam deham asheshena jwaram apadayantihi. As the shloka goes out, the prakupita dosha occurs by the swahetu, and these prakupita dosha enters the amashaya and mixes with the rasa and ushma and obstruct the rasavaha and svedavaha srotas. In this, the dravyasaha pitta remain in the amashaya only, but the vata, what it does, it removes the karmataha pitta out of the
Paktisthana. By Paktisthana, the Ushma out of the Paktisthana, it will take and spreads all over the body equally and creates the Santapa all over the body, leads to Jwara. And in Atisara Samprapti, due to Nidhana, all Jaliya Dhatu Vriddhi takes place, which causes the Mandagni and mixes with the Purisha. All Jaliya Dhatu accumulate with the Purisha due to Adhoghami nature of the Jala, it moves downwards. As in Shloka, they are explaining Kushanum. Here, Varchas act as a stick. When stick falls in a stagnant water, it creates the waves. Like that, here Varchas acts. By that, the Jaliya Dhatu with the Purisha expels out of the body, causes Atisara. It is considered also as Ghora because by this Atisara, the Udakava Srotamula Nasha takes place, leads to Mrityu. And in T2 diseases, why Pitta should be treated? According to Dvibhaddam Subhaddam Nyaya, in case of Samyogri Jwara and Atisara, Atishayana Pitta Shamaka Chikitsa should be performed. According to this Nyaya, if two doshas are involved in a disease, then dominant dosha is removed without harming the other. Then other dosha can be removed easily. Here the word Bhaddam means got stuck. Dvibhaddam means two objects got stuck. Subhaddam means which is easily removable. This Nyaya explained that when two objects got stuck, then if we try to remove two of that at a time, it harms the objects. So we have to remove it one by one without harming the another. As the quotation says, Ushma Pittadrite na asti jvaro na ati ushmanam vina. Ushma will not present, without Pitta, Ushma will not present, without Ushma, Jwara will not occur. So in Samyoga Jwara and Jwara, Atishayana Pitta Chikitsa is indicated. Hence in Atisaro also, Dravaguna of Pitta increases, leads to Abdhatu Vriddhi. So in Samyogaja Atisaro also, Pitta Chikitsa indicated as a Pratama Chikitsa. Then need of Vata Chikitsa in Vyadis other than these two. No living being is considered devoid of doshas, and among all these dosha, Vata dosha has been considered as the prime or chief due to its Yogavahi guna. If it is mixes with the Pitta, it acts as Pitta. If it mixes with the Kapha, it acts as Kapha. Vata alone can cause 80 diseases called as Vataja Nanatmaja Vyadi. So we can estimate the intensity of its diseases and need of its chikitsa. Being a Amurta Dravya, it performs and regulates many functions in the body. If any disturbance to the normal function of Vata leads to Vyadi Avastha. It is comparatively easy to treat the Murta Dravya in case of Amurta Dravya. If a physician does not understand the Vayu, which excels the construction and destruction, how would he able to forearm a patient about the ill effects of Vata well in advance before it affects the body? How would he advise about the normal qualities of Vayu to good health, improvement of strength and complication, lustre, growth, attainment of knowledge and longevity? Discussion in Samsargaja and Sannipataja Vyadi, Apradhana or Anubandha Bhuta Dosha get Prakupita in the form of Vriddhi of its Ruksha, Ushna, Snigdhadi Bhavas and combined with the Pradhana Dosha and produces the Vyadi with Vriddhi of combination of either two or three or individual Bhavas. In this context, if two dosha get combined, then Chikitsa should be performed to Pradhana Dosha. By treating the Pradhana Dosha, its Anubandha Dosha can be easily treated. But during the combination of dosha, if all dosha bhavas become Vriddhi, results in Paraspara Anubandha Rupa, then Samyoga is considered as Samasamyoga. At this time, considering the Pradhana Dosha Chikitsa Siddhanta, first Pitta Chikitsa should be performed. Samsargaja of Rogotpadaka dosha occurs in two different ways, that is Prakriti Samasamaveta and Vikriti Vishamasamaveta Rupa. Considering this Siddhanta, Dallana commented that if any disease occurs by combination of Vata and Pitta, it is considered as similar Swabhava because of their Shoshanatmaka Guna. So this is said to be Prakriti Samasamaveta. But if disease occurs by combination of Pitta and Kapha, then Pitta is Ushna and Kapha is Shita. So Swabhavas of these doshas are opposite to each other. So this is said to be Vikriti Vishamasamaveta in Rogotpatti. In Rogotpatti, which bhaga of dosha get Prakupita, in which matra, same matra yukta, Viparita Guna yukta Chikitsa should be adopted. Conclusion. A concept of Pratama Chikitsa in Samsarga and Sannipataja is opined in different ways by different acharyas based on dosha and Vyadi Avastha. Acharya Sushruta opines that Samsargo Yogariyan Syad Upakramaihe Sa Vaibhave Shesha Dosha Avirodhena Sannipate Tathaivacha. In Samsargaja and Sannipataja Vyadhi, dominant dosha Chikitsa should be performed first without aggravating or harming to the other dosha. These are the references. Thank you and happy Jaraka Jayanti to all.
Thank you, doctor. Wish you the same.
Thank you.
So next I invite Dr. Srikuti for the paper presentation. I invite Dr. Srikuti.
Next, I would like to invite Dr. Anjali Lokhande for the paper presentation. Dr. Anjali, are you there?
Yes, sir.
Okay, doctor.
Hello.
Yes, yes, ma'am.
Dr. Anjali Lokhande, please share the screen, doctor.
Yes, I'm trying to screen share, sir.
Okay, doctor.
So unable to screen share. Hello,
Yes, doctor.
ma'am, unable to screen share.
Doctor, we will call you next, doctor.
So I shared you PPT.
Okay, doctor, we will call you next, doctor.
Okay, okay.
Doctor, you can present next.
Okay.
Next,
So,
I would like to invite Dr. Shankala Hetal for the paper presentation.
Hello.
Hello, doctor.
Hello, sir. Hello, sir. Am I audible?
Audible, doctor.
So it's showing error in just a second. Sorry, sir. It's showing error in my phone.
Okay, doctor. I will share for you, doctor.
Yes.
Doctor, please start the session, doctor.
Thank you, sir. Namaste, everyone. Myself, Dr. Shankala Hetal, PG final year in Rachana Sharira Department, PMT Ayurveda College, Shevgaon, Maharashtra. Today, I am going to present on the topic conceptual study of structural composition of Agnikarma, a cadaveric study. Next. So let's begin with the introduction. The Agnikarma is the Shakagata Marma, and it is in Vaikalyakara in nature, and it is a Snayu Marma. Actually, Agnikarma is 4 in number, and injury effect of this marma is mentioned as Shofa Abhiruddhi and Stabdata, that is swelling and the stiffness. So the description of Agnikarma is available in the Samhita. The exact position and the underlying neurovascular structure in that particular region needs much more clarification. There is need to know whether the marma is situated on the dorsal or the ventral aspect of the upper and lower limb, or both the aspects should be considered. Further, exactly which part of the thigh should be pointed as more vital and fall within the criteria of Ardhangula Pramana. So a humble effort is done in this study to understand the relevancy of the location, anatomical structure, and injury effect of the Agnikarma. This study will help the Ayurveda physician and marma therapist while doing the therapies of on arm and the thigh region. Next, we'll see the aims and objectives. To ascertain location of Ani Marma and to determine the structural composition of Ani Marma. Review of literature. The following books were referred. Means the Samhitas, Charaka Samhita, Sushruta Samhita, Dhallana, Ashtanga Sangraha and Ashtanga Hridaya, Kashyapa Samhita, Bhava Prakasha and Sharangatara. Methodology. The material required while doing the study, instruments required for the dissection, scalpel with blade, scissors, tooth forceps, simple forceps, artery, simple, muscle retractor, gloves, scale, and oil paints, brush, digital camera of 1 to 14 megapixel and cadavers were required in the study. The method. The marma which studied and dissected is Ani marma, which are 4 in number and situated in extremities, 3 angula, above the elbow and the knee joints. First of all, the cadavers kept ready in the dissection hall with all basic requirements, body kept in supine position on dissection table. Before performing the actual dissection, the following steps are followed. Surface landmarks for arm and thigh regions done. Confirmation of the location of Ani marma with the reference of Ayurveda and modern literature was done. And acyclic color and oil paints used for surface landmarks, standard references of Anguli Pramana were taken. Dissection done for the identification of structures at the location of Ani marma. Observation and result. The measurement of Ani marma was taken. As you can see in this picture, 3 angula above the elbow. The measurements were taken. And later the dimension of Ani marma was taken. That is the Ardhangula Pramana. It is circle, yellow circle. And superficial structure, basilic vein was seen. And the deep structure like bicep brachii muscle, distal bicep tendon, brachial artery, and biceps aponeurosis was seen. Dermatomes were marked, and the Ani marma was marked, that is 3 angula above the elbow, and a superficial layer, that is dorsum of the arm, was dissected, and the snayu at the dorsum of the arm was seen. And again the dermatomes on the ventral aspect of thigh region were marked, and the cutaneous nerves at the Ani marma was seen. Tendinous structure at the Ani marma, that is anterior surface of thigh. What are the structure involved? You can see in the picture. Next. And the dermatomes on posterior aspect of thigh were marked, and the marking of Ani marma 3 angula above the knee can be seen, and nerve components at Ani marma were observed. Results. The location of Ani marma marked at about 5.86 centimeter above elbow and knee joints in anterior and posterior aspects. In the arm region, the important anatomical structure observed at anterior aspect were basilic vein medially and cephalic vein laterally, biceps brachii muscle and distal brachii tendon, musculocutaneous nerve, brachialis muscle, radial nerve, and distal 1/3 of humerus bone. The median nerve and brachial artery situated medial to biceps tendon. At the posterior aspect of arm region, the structures observed were triceps muscle with tendon, the branches of posterior antebrachial cutaneous nerve at posterior medial to the tendon and deep to the tendon. The branches of profunda brachial artery accompanied by the radial nerve branches are running between long head tendon and the medial head of triceps. In the thigh region, the important anatomical structures were extensor group of muscle, quadriceps tendon, descending branch of lateral circumflex femoral artery, femoral nerve branches, and distal 1/3 of femur bone were located at its anterior aspect. At the posterior aspect of thigh had the diverging part of musculotendinous part of biceps femoris, semitendinous, semimembranous, sciatic trunk, and distal 1/3 of femur bone. Tributaries of short cephalic vein at the superior aspect, popliteal vein and popliteal artery structures were observed at deep part of marma. The conclusion is, Sushruta explained the Snayu marma helps to bind the muscle with the bone and the human body will be able to carry the weight. In the upper limb, the tendinous hard structure presented in the distal 1/3 of arm within the half angular measurement are the distal biceps tendon and the triceps tendon were considered as structural entity of animarma at its anterior and posterior aspects respectively. Quadriceps tendon at the anterior aspect of thigh and diverging part of musculotendinous part of biceps femoris, semitendinous and semimembranous at the posterior aspect of thigh are the structures pertaining to animarma. Thank you.
Thank you,
Thank you,
doctor.
doctor.
So next I invite Dr. Srikuti.
Hello.
Hello, doctor. I invite Dr. Srikuti. So next I invite Dr. Anjali Yashwantrao Lokhande.
Yes, ma'am. Hello.
Hello, doctor.
Yes, sir.
1 minute, doctor. I will share for you, doctor.
Yes. Thank you, sir.
Doctor, screen is visible, doctor.
Yes, sir.
Please start the session, doctor.
Good evening to all. My name is Anjali Yashwant Lokhande, final year PG student from Ayurved Mahavidyalaya Sayam, Mumbai, Department Dravya-Yastimadhu. Next slide. Definition. The Indian physician Sushruta in the 6th century BC noticed the sweet nature of urine in such a patient and termed the condition Madhumeha. Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defect in insulin secretion, insulin action, or both. Introduction. Type 2 diabetes is sometimes called as lifestyle disease as it is more common in people who don't do enough exercise, have unhealthy diet and exercise. Type 2 diabetes was previously seen mainly in older adults. However, it is becoming more common in younger children due to obesity and overweight children. Etiological classification of diabetes mellitus according to modern science: type 1 diabetes, type 2 diabetes, gestational diabetes mellitus, and other specific types. This slide shows the signs and symptoms of type 1 diabetes and type 2 diabetes. In type 1 diabetes, there is a weight loss, frequent urination, irritability, blurry vision, and fruity breath. In type 2 diabetes, there is a weight loss, excessive thirst, unceasing hunger, headache, and dry mouth. In this slide, the management of DM shows the major component of the treatment of diabetes are medical nutritional therapy. It includes diet and exercise, oral hypoglycemic therapy, and insulin. Diet. Dietary treatment should aim at ensuring weight control, providing nutritional requirement. Dietary management follow individualized meal plan and snacks as scheduled diet based on patient age, weight, occupation, and its activity. Now, Ayurvedic dietary regimen. A good diet plan which is naturally rich in nutrient and low in fat and calories is important for controlling diabetes and managing blood sugar. Diet and lifestyle related etiologies accountable for diabetes as mentioned in the Ayurvedic were rationally reviewed along with the recommendation of Patyahar, wholesome diet. Here, there are so many kapha prakopak hetu which increases kapha dosh and subsequently increases diabetes. Also, type 2 diabetes is a chronic illness that has major long-term implications. In another context, it is said that the excessive intake of dry substances like ruksha ahar light food, lagu ahar, excessive use of pungent, bitter, cool items, excessive fasting. It increases VAT and also cause diabetes. According to Ayurveda, there are mainly two types, stool madhumehi and krushi madhumehi. In stool madhumehi person, diet should be apatarpan guna and heavy for digestion, while krush madhumehi person, diet should be santarpan and light for digestion. Krush patient diet should be such that it doesn't increase the med dhatu. Contraindication of diabetes. Contraindication for diet for diabetes, alcohol, suvira, sukta, sura, milk and milk product, oil, ghee, sugarcane juice, jaggery, alkaline curds, grain cakes, sour substances, sweet drinks, meats of domestic, aquatic, and swamp animals. Few Ayurvedic plants that could be incorporated into the diet are karela, methi, haldi, neem leaves, amalaki, pomegranate. Each plant helps treat diabetes in different way. For example, studies have shown karela reduces polyuria, which partially prevent the renal hypertrophy while also reducing urinary albumin excretion. Each of the plant has been studied in a group of human or animal control and has recommended use. In stolya or obese patient, that is fat, he should be given shodhana apatarpana, that is reduction in body weight by the way of diet control, vayam, cleansing. In such a patient, we can use cleansing therapy like Vaman, Virachan, Basti. In a crush or lean patient, aesthetic type, the treatment should be mainly based on the line of increasing stamina and vitality by the way of tonic, bruhan, diet. And the patient should never be given excessive langan or apatarpan, that is, he should not be starved. Note the patient whether obese or aesthetic. Suffer from the complication like gulma, kakshaya, pain in abdomen. He should always be given some food. A diabetic and obese person generally suffer from excessive appetite and thirst. There are following are the articles of a food which can be given for the diabetes. In cereals, we can use yava, Hadium vulgare, barley are the best different preparation of a food prepared from barley can be given. Example, mantha, odan, bread, roti. This is the subject, the pharmaceutical, and food stuff. So the method of preparation barley is not dealt with here. There are so many cereals like wheat, rice, and in diabetes, we can use old rice instead of new rice. Here are some class of foods we can consume in diabetes. In a grains, we can use yava, godhum, shashtik shali, rice, bajra, shamak, udalak. In pulses, we can use chanaka, adaki, mudga, ulatha. In vegetables, mainly bitter astringent, methi, patol, karela, tandulayak, vastukam, karkotaka, kaddali. In fruits, we can eat jambu, talafala, amalaki, kapitha, dadima, tindulaka. Seeds, methi, kamal, utpala. In a flesh, we can consume chicken, birds, like kapota, tittara, lavaka. Fermented or alcoholic liquids, we can use madhvaso. Other natural products like madhu, madhudaka, we can use. There are so many oils, but nikumba and ingudi oil is, and atasi and sarshak is beneficial in diabetes. Other food and spices, we can use dhani, maricha, hingu, haridra, adraka. Thank you.
Thank you, doctor.
Thank you.
शेयर करें
So next I invite Dr. Rupali Sachin Shinde. I invite Dr. Rupali.
Yes, ma'am.
Hello.
Hello, ma'am.
Hello,
Hello.
doctor.
Yes, am I audible?
Audible, doctor. Please share the screen, doctor.
Yes. One second.
Your screen is visible, doctor. Please start the session.
Yes. Rachana Sharir, PMT's Ayurvedic College, Shevgam. My topic for the presentation is observational study of Manibandha Marmagat Vikruti in females. When we talk about Marma Sharir, it is distinctive concept of Ayurveda. Marma are the locations where Tridosh along with their subtle forms Pran, Soma and Agni are present. Out of total 107 marmas, Manibandha marma, which is located in the wrist, that is Manibandha Sandhi. Painful wrist is a challenge, particularly in females, as it disturbs their daily routine. Objectives of these studies are: 1. To study effects of day-to-day activities of female on their Manibandha marma. Second, to observe the causes of Manibandha marmagat vikruti in females, and to study Manibandha marma in detail. As per Acharya Sushruti, Hasta Prakostayo Sandhane Manibandha Nama. Manibandha marma is Shakhagat marma, Sandhi marma, Rujakar marma. Rujakar means it's very painful. It's Agni Vayu Bhuistat and it occupies a space of 2 angul. Manibandha marma is located at wrist. As practical anatomy, structures falling in Manibandha marma are wrist joint, ulnar joints, radiocarpal joints, radiocollateral ligaments, ulnar collateral ligaments, the muscles, blood vessels, and other tissues are also present around Manibandha marma. When we look at the structure of the Manibandha marma, here it comes various bones, ligaments, which are essential to form the wrist joint. When we talk about the day-to-day activities of females, whether she is working or housewife, from morning till late night, she goes through various daily activities which gives a lot of on her. Factors responsible for Manibandha marmagat vikruti females: Ati Vyayam Vichastita, excessive work, excessive use of wrist joint during day-to-day activities. Second, the most important cause is changes that could affect fluid retention, especially during pregnancy and menopause. And the most important thing is the average woman's carpal tunnel is simply narrower. Certain conditions like obesity, rheumatoid arthritis, diabetes, hypothyroidism are also risk factors considering the frequency of Manibandha marmagat vikruti females. As per Acharya Sushruti, effects of injury to Manibandha marma, Tatra Manibandhe Kuntata. Lots of heavy work and the routine of female is responsible to create functional deformity, that is kuntata of the hand. The other symptoms observed along with the functional deformity and which are responsible for functional deformity are severe pain at wrist joint and hand, tingling and numbness in fingers, weakness in hand, and many times it is observed that there is dropping of objects also. Manibandha marma is well designed to make day-to-day activities of female easily and effortlessly. But considering the structural, physiological pattern and excessive use of wrist joint in their day-to-day activities, females are more prone to get vikruti at Manibandha marma. As per Ayurveda, there are specific therapies recommended to give the best result to wrist pain, that is Manibandha marmagat vikruti. First is Abhyanga, second Patrapinda Svet with Erand and Nirgunti Patra, Shasti Shalipinda Svet, and most important Agnikarma. Agnikarma along the course of median nerve and the distalmost part of the wrist at the carpal tunnel gives excellent result in the pain management at Manibandha Marmagat Vikruti. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Lara Diaz for the paper presentation. Hello, doctor. Are you there?
Yeah. Am I audible?
Audible, doctor. Please share the screen, doctor.
Yes. Is it visible?
Yes, doctor, visible.
Good evening, one and all. Myself, Dr. Lara Diaz, final year PG scholar from Department of Kaumara Britya, SGMCA Udupi. I'm presenting on the topic Sahaja Vyadhi. Introducing the WHO defines congenital anomalies as structural or functional anomalies that occur during intrauterine life. They're also called as birth defects, congenital disorders, or congenital malformations. An estimation of 6% of babies worldwide are born with congenital anomalies, resulting in hundreds of thousands of associated deaths. In Ayurveda, the same is categorized under Sahaja Vyadhis, and Ashtanga Sangra and Hridaya mentions it as one of the Vyadhi classifications while mentioning the diseases. Coming to causes of congenital anomalies, so 15% is accounted to genetics, such as chromosomal abnormalities and mutant genes, and 7 to 10% we have the environmental factors, such as exposure to toxoplasmosis, rubella, cytomegalovirus, etc., or radiations or chemical agents, etc. 20 to 25 is multifactorial.
Excuse me, doctor.
Combination. Yes.
Doctor, your slide is not moving, doctor.
Is it moving now?
Not moving, doctor. It is in first slide, doctor.
Now?
Not moving, doctor. Not moving.
I am moving my slide actually.
Doctor, please once again, please share, doctor, or please turn off the slide share mode.
Okay, one sec. Now is it changing?
Okay, doctor.
Is it changing now?
Okay, doctor. Now changing, doctor.
Okay.
Yes, doctor. Now changing.
7 to 10% accounts to environmental factors, and then 20 to 25 multifactorial, which is a combination of genetic and environmental factors, and the rest 50 to 60% are unknown. Then ARMs, Hirschsprung's disease, omphalocele, gastric when diagnosed late, can result in mortality or risky surgical treatments, and some congenital anomalies can be treated with surgical aspects, and some other as non-surgical aspects like club foot, hernias, etc. Surgically these are the list of surgically correctable congenital anomalies. And since time limit, I have just listed a few of the congenital anomalies which we commonly come across in our OPDs. So starting with Jalasheshaka, it's explained in detail by Vaishaja Ratnavali. Here we have 5 important terms: Sanchiyati Yatkramataha Shirastasneha, Bahula Jala and Duschikitsa. So gradual accumulation of the excess water, which is nothing but CSF inside the brain, and that which is difficult to treat is called as Jalasheshaka. It occurs to newborns, during infancy, and during the period of dentition. So these are the Purva Rupas. They are Kada Vitkata, Daurbalya, Nidradika, and Nihishwasamagdapicha, Putigandaha. Lakshanas are enlisted as follows. So there will be severe headache, blackish stools, reduced urine output, increased blood flow, dry warm skin, vomiting, setting sun-like presentations, redness in the eyes, change in the color of the mouth, grinding of teeth in the sleep, itching, involuntary movements, irritability, and paralysis, and that which is termed shown in green is which is commonly seen in newborns. Chikitsa explained in class 6 is Rechikas, Mutra Pravartakas, Asatoshaharas, and placing a warm cloth over the shaved bald head, and Rasachurnas to be given frequently. Other Aushadha yogas are as follows: Pita Mulyadi Kwata, Sarila Shoshana Churna, Kumkumadhyakata, Rasataila, and Vaini Bhaskara Churna. Surgical intervention, as explained in classics, is a 3 Kurchaka Chikitsa, which is a Shastra with 3 brush-like sharp needles, which is mounted on a strong handle. This can be correlated to hydrocephalus, which is a condition in which there is abnormal accumulation of CSF within the brain. And in newborns and toddlers with hydrocephalus, the head circumference is enlarged rapidly and soon surpasses the 97 percentile. So we have two types of hydrocele, communicating and non-communicating. The word communicating refers to the fact that CSF can still flow between the ventricles, which remains open. Examples: subarachnoid hemorrhages, meningitis, congenital absence of arachnoid villi. Non-communicating, the CSF becomes blocked in one or more of the narrow passages that connects the ventricle. In infants with hydrocephalus, we can see the following features like poor feeding, head enlargement, irritability, suture separations, reduced activity, dilated scalp veins, vomiting, tense anterior fontanelle, open posterior fontanelle, setting sunlight, and transillumination. Whereas in children, there is slowing of mental capacity, headaches, neck pains, vomiting, blurred vision, double vision, failure to upgaze, McQueen signs, stunted growth, difficulty in walking secondary to spasticity. So this is the setting sign, and then is the MRI of the brain, and this is a 2012 case which could not be treated because of the poverty. Next is the sunset eye sign, so also called a setting sun phenomenon, which is seen in infants and young children due to the raised intracranial pressures. It consists of an upgaze paralysis with the eyes appearing driven downwards. McQueen signs, so this is due to raised intracranial tension, and this is seen in children. So tapping the skull near the junction of the frontal, temporal, and parietal bones will produce crackpot sound. Diagnosis is because recording of the head circumference, UAST, CTs, and MRI. Management, so medical treatment have no role in the management of hydrocephalus. So using carbonic anhydrase inhibitors will decrease the rate of secretions of CSF to some extent. Usually, surgical line of treatment is successful. Orofacial clips, we have Kandosha and Kandatalu, which is explained in classics, where Vatakopa is the main factor. And Chikitsa is as follows: Nehana, Svedana, Lekana of the edges, suturing, Vranavatupacharas, and then application of Sharadavatakrita. These are the other applications which has been told in classics. Shushruta, father of surgery, has described surgery of lips, which is being similar to nasoplasty. Coming to cleft lip, it's a development error in the formation of upper lip, which will lead to the formation of cleft lip. And it has been classified as unilateral complete, incomplete, and bilateral complete. The etiology is not known, but it is said that multifactorial as a combination of environmental and genetic factors play a role in this. Clinical problems are feeding problems, nasal regurgitations, middle ear infections, speech problems, psychological problems, and dental problems. So in the pictures, we can see the specialized bottles which are meant for cleft lip and cleft palate babies. Operative treatment is the only choice. Kandatalu, which has been explained in classics, it is correlated to cleft palate, which is a condition due to the failure of the fusion of the three basing components, which together form the palate. So it's of two types, complete and incomplete. Incomplete, the two halves of the palate fail to fuse, and in incomplete, fusion of the two halves of the palate proceed from before backwards. The complications are difficulty in sucking, speaking, speech, hearing, dental problems, defects in smelling, repeated respiratory tract infections, and there are chances of aspiration, bronchopneumonia. Treatment, surgery is the only line of treatment, which is performed between 9 to 12 months. Coming to next, another common anomaly, spina bifida. So it's a congenital defect of the spinal cord, which is involving the laminas. So spina bifida is classified mainly as spina bifida cystica and spina bifida occulta. And under cystica, we have meningocele and myelomeningocele. This is the present pictures of spina bifida occulta, meningocele, and myelomeningocele. Coming to spina bifida occulta, it involves non-fusion of the neural arches, yet there is no protrusion of the spinal cord or the meninges. This condition is mostly asymptomatic and often not recognized. In some cases, there may be patches of hair, discoloration of skin, presence of the dimple, etc. may indicate the pathology. Moving on to meningocele. So in this, there occurs protrusion of the meninges through the defect in the neural arch fusion. This protrusion contains only the CSF, and it's most commonly seen in the lumbosacral region, but might appear in the skull also. Most of these are well covered by skin and are asymptomatic. Coming to meningomyelocele, here the spinal cord protrusion is accompanied by meninges also. Neurological manifestations are almost always present. This may range from sensory disturbance in initial stages, which may later advance to extensive paralysis of the legs. Investigation, so antenatal USG will be carried out, and alpha fetoprotein in early pregnancy, which high amount of AFP will detect this condition. After birth, X-ray chest and spine, USG, CT, MRI has to be done. Management, surgical management is the only line of treatment. So if the lesion is open and leaking, so it has to be performed within 24 hours. And if the lesion is closed, it is within 48 hours. Moving on to Nirodha Prakosha, and it's due to the Vata Prakopa, which so the prepuce, which is non-retractable, thus causing obstruction to the flow of urine, and the flow of urine will be little and associated with the pain. So treatment is Shalaka Prayoga and Shastrakarma as explained in classics, which is correlated to phimosis, which is a state in which male foreskin is unable to retract properly from the head of the penis. This is usually due to unusually tight foreskin. These are of two types, infantile and acquired phimosis. So this phimosis clinical features are physiological phimosis, that is around 96% of the males at birth are noticed to have a non-retractable force, which is said to be physiological, and it only involves non-retractability of the foreskin. Management, medically, topical corticosteroid ointments have been recommended, and dilatation and stretching. Surgical line of treatment only when the medical management fails to respond. Sanirudha Gruta, this is a deformity of the anal canal characterized by narrowing of the anal canal resulting in difficulty on defecation. The predominant dosha is Vata. Shushruta explains these features of this is under the Shudra Roga Adhyaya, where the Apana Vayu getting vitiated at Gudamarma resulted to the stricture of anal canal, clinically expresses difficulty for defecation, and Vagbata also appoints the same. Chikitsa, according to Shushruta, the same treatment like that of Niruddha Prakashan, and as per Vagbata, it's a dilatation by surgical means is the treatment of choice. This has been correlated to imperforate anus, which is a common congenital anomaly wherein the post-alveolar duct and the proctadium are imperfectly fused. Types is as low anomaly and high anomaly. Low anomaly, we have membranous stenosis, covered anus, stenosed anus, and ectopic anus, whereas in high anomaly comes rectal atresia, anorectal agenesis, and cloaca. Diagnosis is invertogram, wherein a coin is placed at the rectum and the distance baby is placed inverted, and the distance between that coin and the rectum is measured. If it's above 2 centimeters, it indicates high anomaly, and below 2 centimeters, it indicates low anomalies. Clinical features, non-passage of meconium is the major clinical feature present. Treatment. Imperforate anus usually requires immediate surgery to open a passage for feces, unless a fistula can be relied on until corrective surgery takes place. Depending on the severity of the imperforate, it is treated with perineal aneoplasty or with a colostomy. Low abnormalities, so a covered anus needs to be opened and then followed by routine dilatation. For ectopic, it's a cutback operation, and stenosine is a regular dilatation. For high anomaly and abnormalities, we have 2-stage operations and one-stage operations. Concluding the topic, congenital surgical anomalies have significant impact on perinatal outcome as well as morbidity in later infancy and childhood. A multidisciplinary approach in managing pregnancy with these anomalies could be implemented. Combined specialty consultations and counseling parents is needed. Thank you.
Thank you, doctor.
Next, I would like to invite Dr. Anjali P for the presentation. Dr. Anjali, are you there?
Yes. Can you share the screen?
Okay, doctor. Doctor, please start the session, doctor.
Okay. So, a very good evening to all. Myself, Dr. Anjali, first year PG scholar, Kai Chikitsa Department, Ayurvedic College, Kerala. So the topic here is the Dashavita Lankanam and its application in various diseases. So coming to the introduction, as we know, diseases are mainly of two types, that is Santarpanajanya and Apatarpanajanya. So based on these two kinds of therapies are there, that is Upakramanasya Dividutta Divita Upakramanam, that is Santarpana is a nourishing or Brahmana treatment, and Apatarpana is depleting of Lankana. And Lankana definition is Yet Kinjit Lakakaram Deham Tat Lankana Smritam. So synonyms of Lankana are Apatarpanam, Lakubochanam, and Upavasam. So coming to the types of Lankana, according to Charaka, Chatushprakaram Samshuddhi Pipasa Marutatapehi, Pachanani Upavasasha Vyayama Shrichi Tat Lankanam. So it can be divided into two broad classifications, that is Shodhana and Shamana. In Shodhana, Vamana, Virechana, Niruham, and Shiro Virechanam comes. And in Shamana, Pipasa, Maruta, Atapasevanam, Pachanam, Upavasam, and Vyayama comes. Whereas according to Ashtanga Hridayam Sutra Sthanam 14th chapter, Ashtanga Hridaya Kara has mentioned that Niruham, Vamanam, Kaya, Shiro Regam, and Ashtravisrati. as Raktamokshanam has been included according to Ashtanga Hridayam. Then in Niraknismedam, Vyayamam, Ushna Sadanam, Guru Pravarnam Chida, Bahupanam, Bayakroda, Upanaha, Ahava, Atapam. Here it is Niraknismedas I mentioned here in which Vyayama and Atapa Sevana, it's one among the types of Lankana. It's mentioned by Charakam Sutram. And qualities of Lankana Dravyas are Laku, Ushnam, Tikshnam, Vishatam, Ruksham, Sukshmam, Kharam, Saram, Kadinam, Chevam, Yed Dravyam, Prayas, Lankanam Smritam. It's mentioned in Charakam Sutram. And features of adequate Lankanam are Vadamutra Pudishanam Visargo Gatra Lakave, Hridyodgara Kanda Asya Shuddho, Tantra Klamam Gade, Spede Kat Jade Ruche Chevam, Chutpipasa, Sahodayam, Kritam Lankana Madeyam, Madisham, Nirvitam, Chantaratmani. So the general indications of Lankana are and Meha, Medo, Atisnigdam, Jwaram, Urustampam, Kushtam, Visarpa, Vidradi, Pliha, Pliha and Shira Kanda Akshiroga. In Stulam also these Lankana therapies are being advocated. And specific indications such as Prapuda Shleshmam, Pitta Asra Malam, Samsrishta Maradam, Brihat Shariram, Balino, Lankaniyam, Vishuddhibihi. And in Yesham, in Madhyava Malarogam, which is associated with Kapha and Pitta Dushti, and in Hridrogam, Vishojikam, Masakam, Jwara conditions also Lankana can be adopted. Eda eva yedodishtam yesham alpabalam gadam pipasa nigraha tesham upavasesha tatniyet. That is, by controlling pipasa and hunger, we can control the above mentioned disease by means of Lankanam. And rogatnyad madhyapa balan vyayama atapa marude balanam kinpunar yesham roganam avarambalam. That is, in avarabala rogis, by controlling the by doing vyayamas, these disease can be controlled. And indications of Lankana related to season. That means, and actually Lankana is to be done during the Shishira Ritu, and also apart from that in Vata Vyadis also Lankanas are to be given in Shishira Ritu, and in Tvak Dosham Pramita, that is Prameha also, these Lankana should be advocated in the Shishira Ritu. And application in various diseases such as in Navajwaram, effect of Lankanam. As we know, all the diseases are due to the origination of the ama, which is nothing but the main treatment for ama is nothing but the Lankanam. So Navajwaram, as we know, it's occurring due to the effect of ama and the body. So Amashya is the origin of all the diseases, and Amashya is a state of Agni also. So whatever diseases which are occurring out of ama can be treated based upon giving the Lankana therapy. So Lankanina kshem nide doshe sandikshite anilim vijvaratam lagutam cheva syopajayade prana virodhinam chevam Lankaninopaparde baladishtanam arogyam yad arte ayam kriyakramam. So in Navajwaram, Lankana elevates the aggravated doshas and stimulates the Agni. As a result of Jwara subsides, thus the body becomes light and there is appetite. So Lankana should be practiced to a certain level, and that is not go against the physical strength. So Lankana should be done, but it must not be against the strength of a person. Next is Apatarpana Chikitsa and Prameham. So as we know, aggravated Kleda and Meda and Kapha are responsible for the causation of Prameha. So in the beginning, one should administer Apatarpana Chikitsa to those suffering from Kaphaja and Paitika type of Prameha. Next is Adravya Chikitsa and Prameham. And Adravya Chikitsa and of Prameham also, Vyayama is mentioned as a major treatment protocol and Prameham in means of Adravya Bhuta Chikitsa. So here in Adravya Chikitsa Prameha, Vyayama is mentioned, which mitigates both Kapha and Meda, which comes under the Dashivita Lankanam. And role of Lankana and Staulium. As we know, Staulium is a lifestyle disorder which is caused due to sedentary lifestyle, which are not by doing exercise, not sleeping in the daytime, and having more amount of food, more amount of anxious food. So these nidhanas should be mitigated. So it is mentioned that Staulium is caused by the increase of Kapha and Meda, and also due to the sedentary lifestyle. And Staulia, Apatarpana Chikitsa is quite important. As we know, Staulium is caused due to the Santarpana Janyavyadi. So Apatarpana Chikitsa is main protocol here adopted. And role of Vyayama in Urustambam. As we know, Urustambam is also Amajanya, Vikaram, and associated with Tritosha. So various exercises, actually, there is Panchakarmas are not advisable in case of Urustamba. So apart from the Panchakarmas, various exercises are mainly recommended in Urustamba. So various exercises such as swimming against the water current and walking a long distance or brisk walk is advocated in Urustambam as a treatment protocol. Then comes the Apatarpana Chikitsa and Kushtam. As we know, and Kushtam is also a disease which is due to the Amatum is there in every of the disease. So in Vadaja Kushtam, Vadotreshu Serpir Vamanam, Shleshmotereshu Kushteshu, Pitotereshu Moksham Raktasi Virejanam Shagre. So here and Shleshmajam Vamanam is mentioned. It's one among the Lankanas mentioned. So in Apatarpana Chikitsa and Visarpam, Lankanam Ulleganam is mentioned as a Chikitsa protocol and Visarpam, which is caused due to the Kafaja type of Visarpam. And in Kafaja Pratishyayam, Kafaji Lankanam Lebha Shirastu Gaura Sashtape Saksharam Vakritam Pitam Vame Pishrestu Navanam. That is in Kafaja type of Pratishyaya also the importance of Lankana here is mentioned. And likewise, in case of Kafaja Shirashulam, Shleshmabhitapam Jirna Ajisnehidam Kadukir Vami Sweda Pralevana Syat Ruksha Tikshnoshna Bojanim Shasindin Chopavaso Atra Nichayam Mishamachre. That is Upavasam, which is one among the Lankanam. Here is also mentioned in Kafaja Shirashulam. So it's mentioned in Ashtangam Uttarasthanam. And in Kafaja Madatiyam also, this is Ullekhanam and Upavasabhyam, Jaye Kafa Madatiyam. So it is clearly here mentioned in Kafaja. All types of Kafaja diseases, as we know, is originated due to the Ama. So whatever Amatum is there in a particular disease, Lankanam is a primary treatment is advocated. So as it is in Madatiyam, Ullekhanam, that is Vamanam, and Upavasa is the main treatment protocol mentioned. And also in Rakta Pitta, Margam, Dosha Anubandham, Chanidanam, Sameekshim, Lankanam, Rakta Pittado, Tarpanam, Prayojit. Here also the importance of Rakta Pitta, Lankanam and Rakta Pitta is mentioned. And coming to Vishujigam, Tatra Sadhi Mamam. So here in Vishujiga, as we know, it's a kind of Amaja disorder, Vishujiga and Nalasigam. Here also, Lankana is the primary and most important chikitsa mentioned. Next, diseases originating from the stomach, as we said above, anything and any disease which is originating is due to the malfunctioning in the Agni. So it's due to the malfunctioning is also only due to the Amatum. So diseases originating from the stomach is must primarily treated with the Lankana therapy. Shanti Rama Shiyuthanam Vyadinam Lankana Kriya Jwarasya Ekasya Chapyekam Shanti Lankana Uchyate. Then in case of Fisher and Ano, Lankanam and Pajanam, Sami, Rupshoshanam, Lagubhojanam. So in Fisher and Ano also these conditions, Lankana and Pajana, along with Lagubhojanam is mentioned in a treatment protocol. So that's all. Thank you.
Thank you, doctor. Thank you, doctor.
Thank you.
So next I invite Dr. Rekha Singh Jadhav. I invite Dr. Rekha Singh Jadhav.
Dr. Rekha, are you there? Okay, next I would like to invite Dr. Priyanka Tiwari. Dr. Priyanka, are you there?
Hello.
Hello.
Hello. Yes, sir. I'm there, sir.
Okay, doctor.
Priyanka Tiwari, sir.
Okay, Dr. Priyanka, please share the screen, doctor.
Yes, sir.
What's slow for us?
Hello. Hello.
Hello, Dr. Priyanka. Your screen is visible, doctor. Please start the session, doctor. Hello, Dr.
Hello.
Priyanka.
Sir, my screen is visible. Slide is visible, sir.
Now not visible, doctor.
Sir, 1 minute, just 1 minute. I'm trying to share, sir.
Okay, doctor. Okay, doctor. Your screen is visible, doctor. Please start the session.
Good evening. Myself, Priyanka Tiwari from final year PG scholar from Alvas Ayurveda Medical College. Today, I'm going to present Udavartini Yoni Vyapat. So, introduction. In Ayurveda, disease related to the female reproductive system are described under Yoni Vyapat. According to Charaka, Vimshati Yoni Vyapada iti, and the classification of all the 20 gynecological disorders based on the predominance of the specific dosha. Samanya Nidana. So Mityacharena tas prinama pradushena artavena cha jayante bija dosha cha deva cha shrunuta prataka. According to Charaka, bij mityachar pradushtartha bij dosh and the deva is said to be the samanya nidan for yoni vyapada. Nirukti. So Chakrapani Tika. उदावृतम इति ऊर्ध्वनितम विकारेण रजस ऊर्ध्वगमनात् उदावर्तिनी इत्युच्यते. Vata is described as a causative dosha of Udavartini Yoni Vyapat. Due to the upward movement of the Rajasa, it is termed as Udavarta or the Udavartini. Various synonyms is given by various Acharya. Acharya Charaka has described it as the Udavartini, while Acharya Shushruta has described it as the Udavarta. Acharya Vagbhata has given it as the Udavrita. Now moving to the Lakshana, Acharya Charaka has said, Atavi Sabhi Tetu Tatashanam Lakte Sukam, Rajasu Gamno Urdvam Gave Udavartini Bhute. As the lady feels comfortable once the menstrual blood flow is start, Acharya Shushruta, Safenila Udavar, Prati menstruation associated with the this Lakshana is said by the Acharya Shushruta. Vagbhata had followed it. According to Hindu Tika, Ya Fenila Udavarta, which is the menstrual blood, is associated with Kapha, Madhukosh Samsa. Hello.
Hello, Dr. Priyanka.
Hello. Sir, am I audible?
Doctor, you are audible.
Audible, doctor. Please continue, doctor.
Yes, sir. Moving to Samprapti, Veg Dharana and leads to Aparmayu Dushti, which causes Dhatu Shaya, leads to Upadhatu Artav Shaya. Sotu Dhanam Sa Vedanam Artav Sa Ati Pravriti, which causes Udavartini Yoni Vyapada. What are the Upadrava mentioned according to various Acharya? So according to Charaka, Gulma Arsha Pradaradimsha, Bath Adescha Atipidinam, Acharya Bhagavata have added Stamba and the Shula. Sadhya Sadhyatva, Panje Sadhya Bhavanti Nama, Yoni Sarva Doshaha, Yoni due to the vitiation of all three dosha is said to be asadhya. Chikitsa, Samprapti Vigatanameva Chikitsa. Chikitsa Pudavartini Yoni Vyapada is mainly divided into two segments, Samanya and the Vishesha. Nahi Pata Dipe, Yoni Nari Nama Sampradushete. According to Charaka, explains, without vitiation of the Vata, women will not get affected by Yoni Vyapada. Vishesh Chikitsa mentioned by Acharya Charaka. Anuprasa, Dashmula Payo Bashtis, Udabar Niladrishu. Snehan with Trevrita Sneha, Sweden.
Hello, Dr. Priyanka. Hello, Dr. Priyanka. Can you hear me?
Yes, sir. Yes, sir. Yes, sir.
Okay, doctor, please continue.
Apatya Yonya Maya Manda Vishagna Upadvisha Paschita, Katu Tikta Kashay Ahar Rasa, Ratri Shita Udaka Snana is said to be apatya for all kind of a yoni vyapada. Moving to conclusion, the patient should be concealed properly regarding the disease and the complication. It is very important to create awareness about the causes and the treatment via education system and media. The management should focus on patient being comfortable with the treatment so that they can continue without restriction their activities. References. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Shruti for the paper presentation. Dr. Shruti, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Yes, sir. It is visible, sir?
Yes, doctor, visible. Please start the session, doctor.
Today I am presenting topic hypertension and Ayurvedic concept. I am Dr. Shruti. I am PG scholar, third year, Shri Ayurved Mahavidyalaya, under the guidance of Dr. Mrityunjay Sharma sir, Shri Ayurved Mahavidyalaya, Nagpur, Maharashtra. Hypertension introduction. The World Health Organization has identified India as one of those nations that is going to have most of the lifestyle disorder in the near future. Hypertension results from a variety of reasons like stress, obesity, genetic factor, overuse of the salts in the diet, and aging and sedentary lifestyle. Hypertension is a silent killer because it rarely exhibits symptoms before it damages the heart, brain, and or kidney. In an analysis of worldwide data for the global burden of hypertension, 20.6% of Indian women and 20.9% of Indian women were suffering from hypertension. In Ayurveda, there is no description of such a single disease which can resemble with the hypertension. According to the Acharya Charaka, in case of unknown disease, the physician should try to understand the nature of the disease through dosha, the site of manifestation, etiological factors, and should initiate the treatment. Hypertension is nothing but a Vata Pradhana Tridosha Vyadhi. If classification of etiological factors, that is Hetu, Lakshana, and Samprapti, is done on the Doshanubandhi basis, then two set of conditions are seen. One is Kaphanubandhi with Vata dominance and Pittanubandhi with Vata dominance. Samprapti of hypertension, Nidan Sevan, Dosa Sanchaya, causes Tridosha Prakopita Rasarakta Dushti, arm production, which occurs Rasavaha and Raktavaha Srotas Dushti, causes hypertension. Which two conditions are considered as Pittanubandhi and Kaphanubandhi. Pittanubandhi includes a Lakshan, normal body weight and lipids, Ritudrava, Shiroruja, Rullas, Brahma and Santapa. And Kaphanubandhi Lakshanas are deranged lipids, Shotha, Stolya, Tandra, Shwasa, Shirogaurava and Guru Gatrata. Factors involved in hypertension. Pranvayu mainly situated in brain vasomotor center, controls the blood pressure by the vasoconstrictor and vasodilator nerves. Similarly, pranvayu also controls the regulation of blood pressure by controlling Vanavayu. Vanavayu is said to be responsible for various kinds of movements in the body. With the help of Vanavayu, heart contracts and circulate the blood, that is rasa rakta dhatu, continuously all over the body. Contraction and dilatation of the vessels are also governed by the van vayu through the heart. Samana vayu, according to the Sharandhara, after the digestion process, Samana vayu helps in the transportation of rasa into the heart, and from heart it circulates in the whole body by the van vayu. Apanavayu, it is clear that there is some effect of excretion of mutra on regulation of the blood fluid, body fluid. Vitation of apanavayu hampers the excretion of the mutra, so the body fluid level becomes imbalanced, which may affect the maintenance of the normal blood pressure. Similarly, in a modern science, sodium, potassium, urea, uric acid, like waste substances, are constitute of the urine, which have to be excreted at the regular intervals, which help to maintain the normal blood pressure. Sadhak pitta. In case of fear, anger and such feeling, the adrenal gland is situated and increase the secretion of adrenaline, which in turn affect the heart rate and cardiac output, ultimately raises the blood pressure, and thus sadhak pitta can be considered as an important factor in the normal physiology of blood pressure. Avalambaka kapha. The normal rate, rhythm, contractibility and tone of the cardiac muscle can be correlated with the function of avalambaka kapha. As Acharya Shushruta has described, Hridaya avalambana karma to strengthen and to nourish the heart of avalambaka kapha. Thus, it keeps heart in a healthy state and enhance its continuous pumping capacity. Dushya, in circulating system, rasa rakta are common entities which circulate all over the body. Therefore, it can be concluded that in essential hypertension, rasa rakta and man are the important factor. Agni have two levels, Zathara Agni and Dhatva Agni. Zathara Agni manda causes formation of ama, which occurs Srotaroda and vitation of the all doshas. It will ultimately increase the peripheral resistance and lead to hypertension. Atherosclerotic changes in vessels can be outcome of chronic Agnimanda and Ama. Mana. In Ayurveda, Manas Bhava such as Chinta, Krodha, Bhaya, etc. plays an important role in the pathogenesis and prognosis of disease, as well as response to the treatment of the disease. Modern medical science also considered involvement of psyche as a causative or factor for the hypertension. Srotas. In the context of the blood pressure, Rasavaha and Raktavaha Srotas are important as they are related to the Rasa Rakta Samvahana. Also, essential hypertension is a psychosomatic disorder. So, role of manas is also very important in this case. Hence, it can be said that Rasavaha, Raktavaha and Manavaha are the srotasas which are affected in hypertension. Clinical features: Shiroruka, Anidra, Klama, Krodha, Arti, Madhasantapa, Tandra, Agnisada, Aruchi, palpitation, that is Hrudadrava, Shotha. These symptoms are seen in the hypertension. Principle of management. Aim of the management is samprapti bhanga of hypertension. निदान परिवर्जन, शोधन and शमन चिकित्सा. शोधन चिकित्सा includes विरेचना, बस्ती, शिरोधारा and नस्य. शमन चिकित्सा includes single drugs, सर्पगंधा, अश्वगंधा, जटामांसी, ब्राह्मी, तगर, शंखपुष्पी, अर्जुन त्वका, वचा, शटी, पुष्कर मूल. Compound drugs are शामक योगा, ब्राह्मी रसायना, ब्राह्मी वटी, सर्पगंधा घनवटी, मुक्तावटी, चिंतामणि चतुर्मुख रस, सारस्वता अरिष्ट, अर्जुना अरिष्ट और पुनर्नवास. पथ्य अपथ्य. पथ्य आहार, diet should be right and low diet, fat diet, and preferably vegetarian food should be included. Whole grain, fresh fruit, mix, java, moog, these are included in the pathya. Vihar, daily exercise, langhana, weight reduction, yoga, pavan muktasana, shavasana, vajrasana, bhasrika, kapalabharti, anulom vilom, brahmari, shavasana, these all included in the pathya. Apathya, avoid meat, egg, excessive protein oil, avoid excessive spicy food and salt in daily diet, and avoid overeating, avoid smoking and alcohol. Weight control, adhyasan, ajirna, viruddhashan, intake of lavan rasa, amla rasa. Veg vidharan, alasya, divaswapa, ratri jagrana, these are included in apathya. प्राणायाम मध्ये सूर्य नमस्कार. Conclusion. In Ayurvedic classics, there is no direct description of found regarding hypertension. So the treatment should be based on the dosha involvement. Hypertension is a Vata dominant Tridosha Vyadhi, being greatly influenced by the morbid state of mana, that is a psychosomatic disorder which originated by involving different factors like dosha, dusha, agni and srotas, etc. Ayurveda described appropriate lifestyle and diet management called as ahar vihar for maintaining homeostasis and thereby preventing hypertension. Proper medication as per Ayurvedic guidelines along with the proper ahar vihar and yoga will definitely control the blood pressure. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Rekha Singh Jadhav for the paper presentation. Dr. Rekha, are you there?
Yes, sir.
Okay, doctor, please start the session, doctor. Your screen is visible, doctor. Please start.
Greetings to all gentlemen present in this gathering. On this holiday, I wish everyone a very happy Charak Jayanti. My name is Dr. Rekha Singh Jadhav. Today, I am going to present a paper on the title of the role of Manas Bhav in etiology and management of the gastrointestinal disease. In India, 4.2% of the privilege present in psychosomatic origin of IBD and 56% health-related digestive issues present in Indian families. It is significant percentage for burden of health expenditure. According to the Ayurveda, all diseases originate from the Mandagni, and Acharya Charak also said that balanced diet also not digestive if following Mansik Bhav, Chinta, Shok, Bhay, Krodh, Dukh, Rajtam also present because these all bhavas vitiated doshas, which is region of Mandagni. Modern science also said psychological factor affect the digestive power and it proved by the brain-gut axis theory. In this paper, we are describe role and association of Mansik Bhav in GI illness and its management. Aim and objectives to explore and establish the impact of Manas Bhav in etiology and management of gastrointestinal diseases. Material method, Ayurvedic classics and relevant online resources was reviewed. This slide is about how mental emotions affect the gastric fire and the affected gastric fire further causes various gastrointestinal diseases. These Mansik Bhavas directly lead to the Agni Mande and clearly And Acharya Charak clearly described that even solitary food taken in an appropriate quantity according to individual Agni does not get digested if person is in state of Chinta, Shok, Bhay, Krodh and Dussaya Prajagrahi. These are the examples of Mansik Bhavas as causative factor of most of GI disease like a Shok in Gul, Krodh Shok in Arshnidan, Kam Chinta Bhay, Pandu and Kamla, etc. Psychological involvement in gastrointestinal diseases. An abnormal psychology of a person in terms of anxiety, anger, greediness, etc. would affect the physiology of digestion. Stress and anxiety make the mind more aware of spasm in the colon. Alternation of the GI motor function are part of the visceral response to these mental emotions. These factors tend to affect the secretion of gastric juice and by that disturb the homeostasis, which may lead to the several GI diseases. The nervous system of GIT is controlled by the enteric nervous system, autonomic nervous system, and central nervous system. ENS regulate the motility, fluid exchange, and secretion and regulate the blood flow. Parasympathetic nerve functions are controlled by the vagal and sacral plexus. This promotes the sphincter relaxations and sympathetic nervous system maintain the contraction of sphincters. According to gut-brain psychology, the gut microbiota is a crucial part of gut-brain and it communicates with the brain via the microbiota, gut-brain axis. Gut microbiota influences various normal mental process and mental phenomena, and they are involved in the pathophysiology of numerous GI diseases, mental diseases, and neurological diseases. Discussion. Almost all the diseases are mainly caused by the impairment of the Agni. Disturbance of Agni leads Tridosh Prakop and formation of Am. Mansik Bhavas have their own effect on it. Am is an intermediate byproduct formed due to the improper assimilation of Ahar, which is due to the improper functioning of the Agni, which will cause DI diseases. Hence, Mansik Bhavas play an important role in the manifestations of gastrointestinal diseases. Conclusion. Primary goal of treatment for disease is associated with restoration of the underlying physiology to correct the dearranged psychosomatic setup. These Mansik Bhavas acting as a stressor should be specified through meditation, adopting Sadvrit in daily life. Quality of the mind is unbalanced by Mansik Vikaras. It has to be treated by controlling particular diet or habits. Thank you.
Thank you, Dr. Reha. Next, I would like to invite Dr. Srikuti PV for the paper presentation. Dr. Srikuti, are you there?
Yes, sir. Sir.
Okay, doctor. Okay, doctor. Please share the screen, doctor.
Okay, sir.
The screen is visible, doctor. Please start the session.
Okay, sir. Thank you, sir. Namaste all. I welcome you all to my presentation entitled Review on Traditional Management of Sarpa Visha. Myself, Dr. Srikuti PV, second year PG scholar from Department of Agada Tantra, SDM College of Ayurveda, Udupi, under the valuable guidance of all the faculty members of Department of Agada Tantra. We find the references of snakes in Vedas, Puranas, and Ayurvedic classics. They are treated to be deity in ancient Indian literature. Samhitas give an elaborate description on the classification, identification, signs and symptoms and treatment of various varieties of snakes. Today, I would like to describe about Kerala Visha Granthas, which describe about the Lakshanas and management of Sarpa Visha. So coming to the classification of Sarpa in Ayurveda, Sarpa has been classified as Divya as well as Bhauma, and among Divya Sarpa, they are classified as Vasuki, etc. And among the Bhauma Sarpa, they are classified as Darvikara, Mandali, Rajimanda, Vaikaraja, and Visha. Today, I would like to concentrate about the Lakshana and Chikitsa of Darvikara Sarpa described in the Kerala Visha Granthas. So coming to the Lakshanas of Darvikara Sarpa, Tathagara Langana Shatra Sustita Tushudarinaha, Pranyaha Shikra Kadayaha Sarpa Darvikara Smutaha. Reference from Ashtami Hardin Uttarastanam, 6th chapter. So coming to the first reference, that is Prayoga Samishaya. It is one of the most popular and widely practiced book in toxicology in Malayalam by Koshuni Tamburan. The book is divided into 11 chapters, and the second chapter deals with the Darvikara Sarpa Lakshana and Chikitsa, and in that, the Vekavat Lakshana has been given as the first Veka, Daha will be the main feature, and the treatment is Lakta Mokshana. And in the second Vega, Granthi and blackish discoloration will be there. And treatment can be given with Marisha with gluten internally. And in the third Vega, drowsiness and lethargy will be there. And Chantana and Ushira Jalapana is advised. In the fourth Vega, tremors and pain will be there. And Tantulia and Ashwagandhapana is advised. In the fifth Vega, Hridroga and Vaidya will be there. And Tiksha Naksya is followed in this stage. And in the sixth Vega, Morsha, Hridroga, Shwasa, Hika are the Lakshanas. And Nasya with Vrindaraja is advised. In the seventh Vega, Prana Vayu will be affected. And Nasya Anjana, that will be Tikshna form will be advised. So in Prayoga Samushya, 26 varieties of Sarpa has been displayed along with the specific features and its treatment. In Krishna Sarpa, Damsha, there will be blackish discoloration of the skin. So Leba with Vrindaraja should be done. And blackish discoloration of nails in case of Shweta bite. So Lepa of leaf of juice of Arka can be done. There will be blackish discoloration feces in case of Shankapalan bite. And their Lepa of Shirisha will be effective. And in case of Valagalan bite, there will be Pana. It is advised to be followed the Pana of Ashwagandha with Kanshi, and there will be blackish discoloration. And in case of Kagodaran, there will be more swelling, and there Purandama Lepa is advised. And Ushira and Chandana Jalapana in case of throat vomit in Mahakarna Visha. And Mahapatma Sarpa Visha, there will be Punanava, Gokshira Lepa, and Pana in case of semi-solid blackish discharge is advised. And there will be weakness of the neck in Kalashadan bite, and the onion paste application will be advised. And in case of Pedikarnan bite, Kshara of Haridra with Gomutra can be followed, and Leba or application of Trikatu in case of Svetana of Anga in case of Vadakarnan bite, and Shundi Lepa and Pana in Shirakarnan bite. Trikatu Nasya in case of Badirada in Mahachavan bite, and Chitraka Lepa in case of itching in whole body in Kandinashan bite, and Shundi Pipali in case of blackish discoloration of urine in Mahasarpa bite. Shundi Pipali, Lepa as well as Pana can be used. Pana with Trikatu for cough in case of Kukuda Sarpa bite. Hiccup in case of Trination bite. Marisha with Kirta should be taken. And Lepa with Alambusha for headache in Parisarpa type of snake. So coming to Kriya Kaumudi, there we can find the references regarding Darvikara Samanya Lakshana Chikilsa, their Lepa from Jirna Artha Patra and Saindama titrated with Gomutra and applied over vertex. Singu, Kulata, Vacha, Marisha titrated in Paribhadra Swarasa, and the Talta done Thavana in Kandilodaka applied over the bite side as well as vertex. Pada, Kanavidam, Trikadu, titrated in Kandilodakam. Paribhadra Swarasa, Marisha, Vacha, Hingu mixed with Gritam at bite side can be applied. Lashuna, Hingu, Marisha, Shundi, Pipali, and Artha Patra. In Karimurka Visha, Visha Punanava mixed with in Karimurka Visha Punanava mixed with milk can be applied as Lepa. So coming to Pana, Nirgundi Moolam titrated in its own Sarasa mixed with honey can be given. Shreda Shankapushpa root, Nirgundi, Ushira, Chandana, etc. can be used for Pana. Ashwagandha, Nili, Pada, Vyosha in Kantalotaka can be used as Pana. Pipalishona with Madhu can be used in case of Shabdi. Ashwagandha, Arka, Moola, and Vrindaraja and Pushta along with milk can be used as Pana. Coming to few yogas mentioned in Kriya Kaumudi, Nirvala Tailam, Mayuranda Gudika, Vajra Gudika, Galatna Gudika, and Agastya Kulamba. Coming to the last Grantha, that is Visha Vaidya Jyotsnika. Visha Vaidya Jyotsnika was written by Govindan Vaidya, and the fifth chapter deals with the Darvikara Sarpa Lakshana as well as Chikilsa. So some of the Lepa yogas are external application of Hingu, Marisha, Vacha, ground in the juice of Kimshuddha bark of the bites, mark substitutes Darvikara Visha, Lepana with Kankana, and Grihaduma ground in urine, and the paste of dried leaves of Shiva Malik and Hindu can be used. Lepana with root of Madhurvadi, that is Dattura, and Hingu with human urine, as well as Lepana with paste of Lashuna, Marisha, Adraka, and Pipali, ground in the juice of Arkapatra can be used. The root of Shvela Veda and Srinkaveda are ground into paste and used as Lepana. So coming to Pana Yogas, internal administration of Yosha with Kanchi or water nullifies or Visha, intake of paste of Ashwagandha with pure water, and the root of Nandyarvatam and Kola can be used. Paste of root of Karancha as well as Kola can be used as Lepa as well as Pana, and mixed paste of Guduchi and Kola can be used. Paste of Shantana and Ushira and mixture of Saintava, Artadala ground with human urine can be used. And oral administration of Shirisha, flowers and seeds of Artha and equal amount of Yosha is ground in Artha. So coming to the last Prayoga, that is Nasya Anjanadi Prayoga. Saindava ground in the juice of Kapula Patra and Datura Patra as Nasya in unconscious poison person can be followed. Nasya Ranjana with Gunja Bija, Marija and seeds of Bakula ground in human urine or juice of Brownie Pushpi can be used. Nasya with Swarasa of Tulasi, Brownie Pushpi with Marija can be used, and Nasya with Swarasa of Vrindaraja and Marija can be used. So these are some of the references I had considered from the books and which can be followed nowadays. Thank you.
Thank you,
Thank you,
doctor.
doctor. Next, I would like to invite Dr. Shema Amol Dorle. Dr. Shema, are you there? Okay. We are come up to the end of the session. Next, I would like to invite Dr. Pooja Sanjeev Shinde. Dr. Pooja, are you there? Okay. Dr. Mayuri Jagannath, are you there? Okay. Dr. Amarda Bhai, are you there? Okay. Dr. Vishwakarma Anjali Gopal, are you there? Okay. Next, I would like to invite Dr. Aishwarya RS for the conclusion. Dr. Aishwarya. Hello, Dr.
Yes,
Aishwarya.
doctor.
Okay.
So thus we come up to the end of today's presentation. On behalf of Team Sameeksha, I would like to extend my sincere gratitude to our panel members for being there. And also I would like to extend my appreciation for those who presented well. So we'll meet tomorrow. Until then, good night.